can start instruction, Varsha. Now everyone has joined, I think.
2 minutes are left, ma'am. Let persons get admitted. Still people are entering. Let them 2 minutes to get it.
Okay. Yeah.
Kavita ji, I request you to rename your Zoom meeting next time, okay? Don't write Samsung SM, you write Dr. Kavita Panchi whenever you use this Zoom. It would be easily identifiable. And whosoever is iPhone, please change the name or write in the comment box who you are. Okay, so right now we have 30 participants enter to the Zoom, and meanwhile जितने लोग भी और enter होने वाले हैं, let them enter. But there are basic instruction for everyone who is joining today's. Okay, Dr. Kamini Pandya, it's fine, but next time please make sure that it should be Dr. Kamini Pandya written in your profile. So whosoever have joined, there are basic criteria for this webinar. Number one, you should always keep your mic mute and your video off till the webinar is going on with Dr. Anshita, so that there should not be any disturbance while having the whole webinar. Plus, if you have any query while asking for this webinar related to the topic, be patient and write all your queries on the chat box, and we'll take everything at the end of the session. Once the madam will complete her proper presentation and teaching, at the end, we will give you 10 minutes to ask every question. So there should not be any hurry. Meanwhile, there should not be any disturbance, and keep yourself very calm and quiet and listen the whole topic first. And then you have your queries and you ask us. Okay, so that is the basic instruction for everyone. And there is always a chat box for all of you. You can write anything what you want and assistance from my side. For today's webinar, first of all, I would ask Dr. Krupali, and I welcome Dr. Krupali, the General Secretary of Gujarat HMAI, and she will introduce the rest of the persons for today's functions. Dr. Krupali.
Thank you, Dr. Varsha. I welcome all of you on behalf of Gujarat State Ladies Wing. I welcome our today's speaker, Dr. Anshita Singh Rathore. First of all, we want to convey our sincere thanks to Dr. Anshita for showing your readiness and sparing your time, valuable time from your busy schedule. It was just a call and you shown the readiness for this lecture. So thanks a lot for that, Dr. Anshita. I welcome Dr. Mona Kapadia, our own Dr. Mona Man, who is the National Lady Secretary, National Wing. Ma'am, you want to say a few words for our Ladies Wing, Gujarat State?
Good afternoon, all. Thank you, Dr. Krupali. Friends, આપણે જે ગુજરાત સ્ટેટની જે ફિમેલ વિંગ છે એ આજે ઓલ ઓવર ઇન્ડિયામાં સૌથી અગ્રસર છે. આજે ડોક્ટર કૃપાલી છે, ડોક્ટર સ્નેહા મજમુદાર છે, ડોક્ટર વર્ષા છે, એવા ઘણા બધા ડોક્ટર્સને કારણે આજે સ્ટેટ ફિમેલ વિંગનું નામ ઉજ્જવળ બન્યું છે. આજે ડોક્ટર કૃપાલીના સરસ કારકિર્દીના હિસાબે અને સારી એક્ટિવિટીના હિસાબે અમદાવાદ ફિમેલ ડોક્ટર્સ યુનિટનું નામ આજે ઉજ્જવળ બન્યું છે. એટલે આજે તમે કોઈ પણ એક્ટિવિટી કરો છો તો આ તમારું યુનિટનું નામ સારી રીતે આગળ ગણાય છે અને તમારી લેડીઝ વિંગનું નામ આગળ ગણાય છે. તો ફ્રેન્ડ્સ, આજે ઓલ ઓવર ઇન્ડિયાની અંદર આપણે પ્રયત્ન કરી રહ્યા છે કે લેડીઝ વિંગ બનાવીએ અને આપ સૌને નમ્ર વિનંતી છે કે આપ સૌ આપના યુનિટનું નામ ઉજ્જવળ કરો અને અઠવાડિયામાં મતલબ વીકલી 1 કે 2 hour આપીને પણ સારી એક્ટિવિટી કરી શકાય છે. જેમ કે તમે ફેસબુક, ઇન્સ્ટા એ બધા પર પણ તમારા વિડીયો અપલોડ કરો, ગ્રુપ બનાવો અને ગ્રુપ ઇવન મેડિસિન વિશે કહી શકો છો, સમર ડિઝીઝ છે તો એ રીતે કરીને હોમિયોપેથીના પ્રચાર આપ કરી શકો છો અને આ રીતે તમારી એક્ટિવિટી ગુજરાત સ્ટેટને ફોરવર્ડ કરો જેથી આ ઓલ ઓવર ગુજરાતની અંદર તમારું નામ રોશન થાય અને તમારા યુનિટનું નામ તમારા દ્વારા રોશન થાય. તો આપ સૌને નમ્ર વિનંતી છે કે જેમ અમદાવાદ અને સુરત, કચ્છ વગેરે આટલા યુનિટો ખૂબ સરસ રીતે કામ કરે છે એવા દરેક નાનામાં નાના યુનિટ પણ સરસ વર્ક કરે અને આગળ આવે અને આપણી યુનિટીને સબળ બનાવે તેવી અભિલાષા રાખું છું અને આપ સૌને આ તકે સૌને અભિનંદન આપું છું કે આપ સૌ અહીં સાથે મળીને આપણે ગેધર થયા છે અને આ એક્ટિવિટીને આગળ વધારી રહ્યા છે. થેન્ક યુ સો મચ.
Thank you so much, Mona ma'am. Now I welcome Dr. Varsha, our own Dr. Varsha, a very popular YouTuber of Ahmedabad.
Thank you.
First, I want to convey thanks to you also because of your portal only we are here and join and witnessing this webinar. So thanks a lot for that. Dr. Varsha is MD in homeopathy, who is a practitioner at Ahmedabad and also a professor at Vadodara College. So, and a famous YouTuber of Ahmedabad. Her channel name is Homeo Health. No? It's what's your channel
Homeopathy
name?
by Dr. Varsha.
Yeah, Homeo Health, Dr. Varsha. So thanks a lot, Dr. Varsha. Now over to you, and you will introduce our today's speaker. Thank you. Thanks a lot.
Thank you, Dr. Krupali, for giving me a chance to be a part of HMAI function, and Dr. Mona ma'am, who is always very passionate about such type of functions and believe in me to conduct such type of webinars and be a helping hand to HMAI and homeopathy. And talking about today's speaker, तो आज का जो टॉपिक है वो है acute emergencies in pediatrics. We always think that homeopathy only works when there is a chronic cases and non-emergency cases. But today's speaker will break the myth that acute emergencies can easily be handled with the help of homeopathy. Especially in the pediatric cases, जहाँ पर हमको ऐसा लगता है कि बच्चे होते हैं, बच्चों को कोई तकलीफ होती है तो पेरेंट्स जल्दी डर जाते हैं और डरने की वजह से वो तुरंत ही एलोपैथ के पास ही भागेंगे, होम्योपैथ को सीख नहीं करेंगे. लेकिन आज के स्पीकर ने ये सारे मिथ्स तोड़े हैं और उन्होंने इसके ऊपर बहुत सारा काम किया है. तो टॉकिंग अबाउट टुडेज स्पीकर, डॉक्टर अंशिता सिंह राठौर. She is a BHMS and MD in Organon of Medicine. She has also done her diploma in clinical counseling, certificate course in clinical nutrition, certificate course in therapeutic yoga, and she is expert in therapeutic yoga in Pune. She is also she is an homeopath, practicing homeopath since long. She has a clinical experience of 15 years. She is a psychiatric counselor, nutritionist, and expert in therapeutic yoga. She is practicing properly in Pune. She is also a special inclination in the treatment of mental, emotional, psychosomatic disorders and number of chronic and autoimmune illnesses which are associated as a resultant of emotional stress and trauma. The reason behind for this inclination for her, because she has done her thesis on the personality disorders. She has been writing the article related to homeopathy in multiple journals, blogs, etc. She conducts the corporate health talk sessions and webinars. She has presented her homeopathic management of anxiety disorder paper in the International Homeopathic Conference held in Jaipur in 2013. She is passionate on teaching part, and that's why today she is here to teach us all how we can handle the acute emergencies in pediatric cases. She is also a faculty in multiple paramedical colleges, and She runs a study group for budding and young homeopaths. She is also a mother of 2 children, and still she is very passionate about her own profession, and she does a multiple work to enlighten the homeopathy and homeopathic knowledge. So, Dr. Anshita, I welcome you wholeheartedly from the whole team of HMAI.
Thank you, Dr. Varsha.
Sorry for if anything I have missed on your introduction part.
That's been quite generous here.
Thank you. But I would ask you, ma'am, ki whenever you need any help, I'm always there to help you out on the Zoom meet. So if you have any query or any problems, just let me know.
For sure, definitely.
The whole platform is yours. You can start with the webinar now.
Yeah. First of all, I would just like to say that I was not aware there was a special women's wing for HMAI for the female doctors. I was totally unaware of this. And when I heard about this, it made me really excited, and I was very happy about it. Ki, mostly, in these kind of organization, we see a male dominance. I have seen majority of male doctors in all the organization, and then having a women's wing, so many participants, it's really amazing. I wish they have one for Maharashtra also, and I would certainly join if that is a possibility for me. So anyway, congratulations to you guys who have been running this wing. So with that, I would like to start my presentation and not waste any time. So I'll just start with this presentation. I hope we have sufficient number of people.
There are 243 right now, and they are joining. So you can start right now.
વર્ષા વોઇસ નથી આવતો.
મેમ સ્ટીલ એમને ચાલુ નથી કર્યું, સ્ક્રીન શેર કરે છે.
Okay.
Sorry, it got muted, I think. Dr. Varsha, you were saying something.
No, ma'am. If you have any doubt or anything which is not working, let me know, ma'am.
Yeah, I'm just starting the slideshow.
Yes, ma'am.
Yes. So pediatric acute cases, case management with homeopathy. This is our topic for today. And it was hard for me to select cases for the presentation today because we had so many cases. And just for your information, on a daily basis, we have a OPD of about 25 to 30 people per day. And out of that, at least 50% are pediatric cases. And may say be about 50 to 60%, half of it are acute cases. Sometimes people will come to us with a fresh case. Those are our old patients that come to us with a fresh case that symptoms have just appeared today. Aaj subah se ye hua hai, kal raat se fever aaya, and such things. And then there are those who have already taken a course of allopathy medicines, but they have not found any relief, and then they come to us. So we'll be showing both type of cases so that you can understand how we can replace allopathy here. That is also very relevant to us because majority of the kids and people who are coming to us are already taking allopathy. And then we also need to learn to educate them that how we can completely rely on homeopathy here and not go to the allopaths unless it is something really grave. This is what we have to learn now. And most of the people prefer homeopathy for their kids because it is more palatable, it is safer, and parents and even grandparents will often insist that we should give homeopathy to the kids because it is safer. Majority of the population already knows that antibiotics are not safe and anti-allergics are causing some detrimental effects. But still there are some who needs to be educated, and it is our job that we have to educate them and spread awareness about homeopathy in acute diseases. One of our doctors was saying that we need to post videos and be more active on social media about these things. be more vocal about this, that what we are doing, how we are giving good results in acute prescribing. So this is what we have to learn and increase our confidence about the matter. And for that, we have to have a very precise understanding of acute prescribing. We have to know our keynotes. We need to use repertories. We'll come to that also. I'll show you some repertory sheets as well if time permits today. So these are the things I want everyone to know and learn, that this is how you make an acute totality. This is how you take an acute case. This is how you analyze it and come to a bullseye prescription. Common myths are there that homeopathy slow hai, infants ko nahi de sakte hai, and it is not useful in acute but can be given later to increase the immunity. I don't even know what that means, honestly. But breaking that myth, I would say that we have seen amazing fast results within few hours of prescribing our medicines. You see that in our cases. But slow to bilkul bhi nahi hai. Again, there is one aspect to it, which is some patients have a slower response. Some patients will have a slightly slower response, and some patients have a very fast response. And usually, luckily, kids have a faster response as compared to adults and even teenagers. Small kids, toddlers, infants, they have quick response to homeopathy, which is a big boon for us, because this is how we can हम मैदान जीत सकते हैं, ऐसा कहना चाहिए मुझे, because we are giving fast results. Then about the infants, a lot of people have this notion that homeopathy cannot be given to infants. It can only be given after a certain age, like 9 months onwards or 1 year onwards and such things. Although a lot of people are giving medicines like calcarea phos and this dentonic like things to their kids, even then they believe so. So I would like to tell you that we have given my youngest patient was around 2-day-old baby, not 2 but somewhere like 2.5. So there is an interesting story about it. This patient of mine, they were my old patients, and she delivered her second child. And while she was coming back from the hospital, she was going home, and then she would be in confinement for next 40 days. So what she did was, she was very smart. Directly from the hospital, she came to me, and I met the child. It was a beautiful baby girl, and then she took all the common medication which we usually need for the babies, and she wanted to just meet me once for maybe some emotional support probably. She took all the medicines and went home, and then after that they moved to US, and we have been consulting from US since the day that girl is born. The girl is around 5 or 6 year old now, and she has never taken any allopathic medicines at all. She hasn't even taken a crocin till date. So that was about the youngest patient, that we can give homeopathy to babies. How do we give homeopathy to babies? I'll tell you. We take the globule and crush it a little bit, mix it with breast milk or formula, whatever the baby might be having. Although we encourage breastfeeding, so you take take the milk in a bowl, you mix single globule in it, and you give that milk to the baby. And this is how it is given. If it is a biochemic we are using, then we do the same process. We crush it, mix it, and give it. And babies older than 4 months, they are able to take smaller globules. Smaller globules, usually I use 30 number. They are able to take it, and they really like it. And once the tongue reflex is gone, they are able to take homeopathy very happily. In fact, they love it. So that again, it's a plus point for us that kids love it. We have some patients who would, when they're sick, they become clingy, right? Kids become clingy when they're sick. So they just want to go to their doctor. So take me to Dr. Anshita or whatever. They would tell their parents. So this is how they depend on us. This is how much they rely on us, that when they fall sick, they want to go to their doctor or do a video call with the doctor. And this is the level of trust they have with us. Then again, homeopathy should be given later to increase the immunity. Well, so what my experience, and now my experience is about 17 years in practice. So in 17 years, and after having 2 kids of my own, I have learned that once you start giving homeopathy, even in an acute case, whether you have given a simple remedy like a belladonna or a simple remedy like a pulsatilla, it automatically increases your immunity, because when in the acute disease, your body was fighting on its own with the help of homeopathy alone, already your immune system is awakened, it is working well. But if we do the opposite of it, if we give antibiotics and suppressive medicines like antihistaminic and all the Sinarest and Monter and Maxtra, then the immune system is disturbed already. So the moment you start with homeopathy, immunity is already increased. Even if you don't give any constitutional prescription, even if you don't give any no sort anything, you still see that there is a change. The change is the episodes of the illness have become milder, shorter, and sometimes they will manage with something as simple as biochemics. Not even a proper homeopathic prescription, but simple biochemics. So this is how the immunity is built. And why I'm telling you all this, I'm sure you all are practicing, but some of you might not be so confident in dealing with the acutes and being able to answer the patient queries. For example, if the patient is asking us how the immunity is built with homeopathy, so this should be your answer, that when we help the body fight an infection with the help of homeopathy, the immune system is already awakened, it is already active, it is already supported, it is already stronger. And day by day, as you keep giving homeopathy in all these acute episodes, your body becomes much stronger and the episodes are much less. So this should be your reply to your patients, to to the attendants. Again, there are some kids who are sicker than others. For example, when there is a genetic history of asthma, autoimmune disease, kids who are having a history of eczema has been suppressed with allopathy. Such cases do need an acute prescription and then again a chronic prescription. They need both. There is another myth I would like to address. Yesterday, Dr. Krupali and myself, we were discussing that there is only one constitutional remedy and nothing else. Well, friends, I would like to tell you that yes, there is a constitutional remedy, but constitutional state also changes with age and stages and even disease wise. And the best example for this has been COVID. During the treatment of COVID, we needed several remedies in succession. For example, in initial fever stages, we needed a remedy X. For example, China was given. Then in the later stage, when the fever was gone, the patient is developing coughing and phlegm, you might need a different prescription. And worst case scenario, if it is going into a longer COVID in the second or third week, you might need a third prescription, something to remove the debility, to reduce the hair loss, and such things. For example, acid phos. We had used acid phos, Evina, and then Rhinum and such sulfur even for the long COVID symptoms. So COVID is the best example here, that acute, subacute, and long-term effect of that acute illness or viral disease. So one single remedy may not be able to cover that. Yes, if you are lucky and very strong person, immunity-wise, you might be able to manage with one. But a lot of people needed multiple prescriptions and sometimes even mother tinctures, which I very often use in my practice for faster results. So coming to the acute and chronic prescriptions, during my early practice, I was exposed to Dr. Vijaykar's books. For some reason, one of my friend told me about it, and I was lucky to attend one of his modules in Mahabaleshwar. It was an amazing experience. Dr. Vijaykar was there at that time. It was many years ago. It was about 18 years ago. So the Dr. Vijaykar's theory of acutes, I would urge all of you to read that, go through that, learn that, mug it up. Theory of acutes and the chart of acutes is such a boon to busy homeopaths. If you are busy in clinic and you don't have so much time to take the whole detailed case in an acute, for example, if a person is coming to you for X complaint and he's saying, "Doctor, my son is having a bad cough. Can you see him?" Now they don't have an appointment. You may not have time, but you can give 5 or 10 minutes to take a short acute case and make an acute totality and prescribe a very simple common medicine to relieve him of the stress. So in such a case, this theory of acutes has been very useful. In last 17 years, I have made my own additions in that chart of acutes. And I find it extremely handy on a busy day. And even sometimes when there is no clear-cut symptoms, sometimes the symptoms are very vague and all you are getting is common symptoms of the disease. Still, the chart is useful. So I would urge all of you to learn that chart and practice it and see how it helps you. And I'm sure you all will be thanking Dr. Vijayakar for it. And again, I'll tell you, Dr. Vijayakar's chart is not something extremely unique. These things we have seen in our materia medicas and we have seen in Dr. Hanneman's cases also. But the way Dr. Vijayakar has formulated the chart and made it all easy for us, it is very good. So acute prescribing is made very easy with this. One more thing that I would like to add here that I would suggest all the listeners to study is the remedy relationships. Gibson Miller, remedy relationship. This is a tiny book. Most of us don't know about it because it is a very old book and it is not very popular. But it is a book that tells you about relationship among the remedies. For example, belladonna is acute of sulfur, or arsenic follows well calcarea, or hypersulf might be an acute to calcarea carb or calcarea group. Bryonia is acute for natrums and such things. So if you remember all these things, and suppose you are looking at a natrum patient, a patient who is a natrum mule or a natrum carb constitutionally, and he comes up with a headache, so it is very easy for us to prescribe a bryonia, but we still need to confirm the so sorry, we still need to confirm the physical generals here, but yet it still makes our work a little easy. Also, in cases where you are stuck somewhere, for example, you are giving sulfur and you're not getting results after some time, you may think of a similar remedy, a complementary remedy, and follow well remedy, which is given in the Gibson Miller remedy relationships. So this comes in very handy to you, and I would suggest all of you to read this. So, myth busting. So, like I said, good results will bust the myths anyway. Patient education, verbally telling them, writing blogs, social media and reviews. These things are very useful. And you will see that how young parents come to you saying that डॉक्टर हमारे नेबर ने हमें भेजा है, उनका बच्चा बहुत बीमार था, अभी बहुत अच्छा हो गया है, हमारा बच्चे को भी same problem है. That's why we came to you and we have heard a lot about you and such things. So word of mouth is the best for awareness among parents and even in school groups, society groups, colony groups, and various places. So once you start treating kids and all their friends will come to you. Let's start with the cases now. So this is the first case.
Ma'am, please, you have to share your screen. Screen is not visible.
Okay, screen is not visible.
Yes, ma'am.
One second. Okay.
Yes, ma'am. Now it's visible.
Yeah.
Meanwhile, if you need any help, let me know.
Sure. So this is our first case, Master Shlok, and he's a 5-year-old boy. This is a case from January 23. This boy is having cough since about 15 days. 2 weeks ago, he had a viral episode of viral with cold and cough. And since then, the cough is persistent. Better by honey or water. Dry cough is there. 3-4 a.m. aggravation is there. Lying aggravation is there. Either it is day or night, but lying aggravation is persistent. There is swelling in the right nostril, thick mucus. He has taken ibugesic, Meftal, anti-allergic. Sorry, I'm down with cough myself. Appetite is good. Thirst is good. He asks for water and desire for sweets, cold drink, ice cream, etc. Bedwetting, hair. Although he's 5, but still bedwetting is there. He's using diaper. Patient is hot. Right now, there is no wheezing, but lot of cough is there, and it's been 15 days. Before we go forward, I would like to tell you one thing. Ibugesic. In my practice, I have seen that kids who have been taking ibugesic or meftagesic or ibuprofen in any forms, imol is also same. They tend to come up with a lot of URTIs. First, you take ibugesic for fever. Fever is suppressed, but a kind of a reaction and inflammatory response is there in your respiratory system, which leads to URTI. And every time their pediatrician will write ibugesic, then they will come up with URTI, and then they will say, now you give antibiotic, and now you nebulize the child 3 or 4 times with Bodecort and Esthalid or Levolid. This is very classical example. That's why I mentioned that ibugesic should not be used, or any similar drug should not be used for any kids, especially in the COVID times. If you are suspecting COVID, even and COVID cases are there, we have a lot of COVID cases. Even the cases which I am showing you, some of them are COVID cases actually. Only thing is we have not tested, we have not confirmed, because nobody is testing these days. Plus, the test kits are obsolete now. So whenever ibugesic is taken, URTI is bound to happen, especially if it is taken for a couple of days. If you take 1 or 2 doses, it might not do this. But if you are taking ibugesic for a couple of days, 2 or 3 days, this might happen. So you have to educate your parents, patients, attendants about not using ibuprofen in any form for kids, especially, and not even adults, because it is not a safe drug. Even those who are manufacturing, they are saying, I have a patient who is into manufacturing of drugs, and he himself says that ibugesic hamare ghar mein ban hai. So imagine those who are making, they are saying this, and yet we are using it. So I do allow crocin syrup occasionally. If the fever is very high and the patients are very restless and they are not able to tolerate, or they are not able to come to me or pick the medicines, I allow only crocin, otherwise no medicines. I ask them to wait for some time, do sponging, give the child a bath, and wait for some time, the fever goes down. So coming to the case again. Okay. Okay. So allergic symptoms are there in this child, and at birth he had moderate jaundice, weight was less, 2.7 kg, is a lean child. Then mother is also having allergic symptoms. Social interaction is good. He is excited about exams, happy, active, likes animals. He's a quick, social, loves to talk to strangers, makes friends. Basically, he's a happy child. My first prescription was Causticum 30. Now, Causticum 30 has been very useful, a savior. It lasts around 6 to 8 months. A lot of kids were coming to us with this typical nighttime cough, and they were helped with Causticum. The main modality here is cough only in the day or only in the night. Either day or night. दोनों में से एक, दोनों नहीं. Plus voice changes, and better by drinking water. Causticum is relieved by drinking water. So immediately the child got better. We did a follow-up after 7 days. So cough was almost gone. Occasionally in the morning he was coughing, else he was fine. So we continued Causticum 30. At night, 4 pills only. Why we continued for 15 days? Because the child has been sick for a long time now. So I told them to take one dose only at night, and then we stopped. Now, a discussion part. Incidentally, we also found a small warty growth on her nose. And you know that Causticum, helps with the warts also. And I would like to urge you all to read the Cali group medicines in cough and cold and catarrh symptoms, asthma symptoms, and they have been very useful here. Sorry. Okay. So this was our first case, and later on this child came with another acute issue where we had given belladonna. If we have time, I would like to show more, but right now today we have some 8 cases here. And second case. Okay, this is a female toddler, preschooler, prolonged cough since school has started, severe cold is there, bouts are there, worse on. Okay, this child, the mother of this child is a doctor herself. And this child has been sick from the day she was born. I happen to know these individuals. Mother is a doctor and she keeps giving her nebulizations almost every week. So since the day she's born, she has been sick. It was a very bad case. And even I had suggested a couple of times that you should start with homeopathy, but the mother was hesitant, or maybe sometimes their ego comes in the way. That and then I told her, "Abhi bas ho gaya. You have done enough. Good, budekot, abhi bas." So cough is there, worse on lying. Lying aggravation is there. Although day and night cough is there, but at night it is worse when she lies down. And a lot of vomitings are there at night. After coughing, she'll puke. Ailments from sour, sticky, watermelon, cold weather, chocolate, candy, etc., etc. All the common triggers are there. Nose congestion, thick mucus. Fever comes occasionally. So cough syrup off and on, Levolin, Budecort, vagera. Okay, appetite, thirst is average, desire for sweets, candies, chocolates, etc. And lean child sleeps well if she's not coughing, no gynec history. Okay, mental symptoms. Talkative at home, but shy. Once she opens up, she'll talk a lot. Screen time is there 3-4 hours because she's sick. She's not able to play outside. The mother is not sending her outside because of fear. And sharing depends on her mood. She's a very moody child. The mother mentions that she's very moody, and she will follow instruction if she wants to. She'll share if she wants to. Crankiness is also there because of the screen time. Kids who are falling sick very often and spending too much time on the screen, they tend to become very irritated, aggressive even, especially boys who are gaming a lot, they become very aggressive. So if a patient is telling you that हमारा बच्चा बहुत चिड़चिड़ा हो गया है और मारने लगा है, तो आप सबसे पहले उनका स्क्रीन टाइम जो है वो कम करवा दीजिए या बंद ही करवा दीजिए. This is also my personal experience with my own kids. I have 2 boys. And I have seen this in other cases as well. When the screen time is increased, up your phone, they hope they are happy. But the moment you take it, they are super cranky. So it is making things worse every day. So what we do is we stop completely, band karna hai screen. And it should be given as a treat sometimes. For example, if the child is finishing their homework, they're eating properly, they're finishing all the vegetables from their plate, then as a reward, as a treat, they can be given a TV time or screen time for a certain number of minutes. For example, 30 minutes or so. It should not be that phone pada hai, kabhi bhi uthaya khelna chalu, because it makes the kids very cranky. I would also like to share one thing here. During the pandemic, when the kids are at home and parents were busy doing jhadu pocha and household work and various things, kids became dependent on the screens. And the toddlers, the preschoolers, they developed a speech delay and even speech regression. We had cases who had speech regression. इसका मतलब क्या होता है? बोलना शुरू किया, थोड़ा थोड़ा बोलने लगे 1.5 साल में, 2 साल में, और फिर स्क्रीन टाइम बढ़ गया, and then they forgot how to speak. They stopped talking. They are speaking in very peculiar language. Peculiar language मतलब YouTube के वीडियोस में जो ऐसी लैंग्वेज और एक्सेंट बोला जाता है, वो लैंग्वेज और एक्सेंट में बातें करने लगे, rather than talking like a normal person. And they are always talking in either English or Korean or whatever language they are hearing in the cartoons. वैसी ही language, वैसा ही accent. So it is not independent speech. It does not count as an independent speech. It is a type of speech regression, and they are only तोते की तरह वो रट रहे हैं जो उन्होंने वीडियोस में सुना है. So if a patient is coming to you and talking about this thing, मेरा बच्चा बोल नहीं रहा है, आप स्क्रीन तुरंत बंद करवाइए, तुरंत 0 करवाइए. कई पेरेंट्स को ये लगता है कि बच्चे यूट्यूब से सीख रहे हैं. ऐसा नहीं है. They are hardly learning anything from YouTube. They are just doing time pass and picking up sometimes even wrong things. You are supposed to teach them whatever things are there around us. हाँ, ये पेन है, ये डोर है, ये कलर है, ये फ्रूट है, ये ऑब्जेक्ट है, ये कार है. This is how they learn, with relating yourself to it. कार में हम बाहर जाते हैं, ये कार है, ये रेड कार है, कार कौन चलाता है, कार डैडी चलाते हैं, हॉर्न कैसे बजता है. These are the real things that we have to teach the child and spend time with them, right? Some parents will say that we don't have time to spend them time. Well, then they have to be educated about it, that yeah, you have given birth to a child, you need to give them time. YouTube is not something, it is not a learning tool basically. Okay, enough about YouTube. Coming to the case again. So we see here that this is a very allergic child and coughing on lying, especially a lot of mucus formation and very moody child. I'm sure we all can guess the remedy. Pulsatilla 30 was my main prescription. It was given for 15 days. Since the case is kind of a chronic, that's why we gave it for 15 days. Plus, the weather was bad. It was the month of December, so the weather was a little cold and bad. That's why we gave it for the 15 days. Then Aspidosperma Q was given. So to most of the kids who are bronchitic, allergic, I prefer to give Aspido. I also use other tinctures. If in case you want to write down, you can note. I use Blatta Q. Now Blatta is, we all know the source of Blatta. So some of the patients who are purely vegetarians and they don't like the smell of Blatta. So I use it less over my pediatric patients, and especially who are vegetarians. But Blatta is an amazing prescription. It is extremely effective. Aspido is one of my other prescriptions. Besides that, we also use Cassia sophera tincture for a lot of phlegm. If the phlegm is there, too much phlegm is there, then we use. Justicia tincture is used. Sometimes it is useful in the middle stage when there is phlegm. If you give it in the later stage when the cough has become dry, it makes things worse. So don't use it in the later stage. Then I use Seneca. Seneca Q has been effective in various types of coughs. I would urge you all to read it once from various resources, especially Boric, and use it and try it out. These tinctures are very effective, they give good results. But I would also like to warn you all to not rely on tinctures completely. 100% rely mat kariye. Always you have to have a good proper prescription as per the totality. आपका जो tincture है वो एक supporting actor है ना. Main hero जो है आपका वो यहाँ pulsatilla है. Aspido is your supporting actor. Supporting actor is helping the hero in his job, but hero is hero. So always remember that, and do not rely completely on tinctures. I would like to share one instance with you all. One of my colleagues, he is also experienced, 16 साल का उसको भी है experience. So he mixed various tinctures. He was experimenting. This was a few years back, 5-6 साल पहले. He said, let me just experiment. He mixed few tinctures, common tinctures of similar symptoms, and he gave it to his patients. And then he tried it for a couple of months. And then he shared the conclusion with us. The conclusion was it did not work. काम नहीं किया, कुछ काम नहीं किया. In fact, sometimes it was the confusing result. कि एक दिन ठीक लगा लेकिन अगले दिन फिर वैसा हो गया. So if you are relying too much on a tincture, I would warn you to not do that. But yes, some tinctures are extremely useful. Like Aspidosperma has been very useful in case of asthma, bronchitis and all. Then my third medicine, if you can see, is Drosera. Drosera was given for 1 day. Now why we give Drosera? Let me explain. Drosera is a very tubercular remedy. Okay, I'm sure you all will read today. So single doses of Drosera and occasional repetitions are very useful in a type of cough which is dry at night. Whoopy sound. जैसे अभी मैं खांस रही थी, आपने सुना होगा, there is a whoopy sound. Whoop is there. That, and a kind of vomiting sensation is felt, and sometimes after coughing, the child or the person, especially a child, will vomit. खास उल्टी करने के बाद सो जाएंगे. This is Drosera. And इतनी खांसी होती है कि चेहरा लाल हो जाता है. इतनी खांसी होती है, whooping sound, ऐसा लगता है कोई बूढ़े लोग खांस रहे हैं. उनके चेस्ट के अंदर से एक साउंड आती है जैसे कि बैरल में से आ रही है. To read the Materia Medica from Boric, you will understand what I mean. So a dose of Drosera, actually we gave 1 drop, and then Pulsatilla and Aspidosperma was continued for some time. Okay. Follow-up. Overall, the patient was much better and coughing was occasional. Allopathy medicine was completely stopped. Her mother complimented us that Anshita, पहली बार ऐसा हुआ है कि 15-20 दिन से उसको एक बार भी नेबुलाइज नहीं किया है, अदरवाइज हम उसको हर दूसरे दिन नेबुलाइज कर ही रहे थे. This was a compliment for us. Later on, she told me that hypopigmented patches were there on the face, which a lot of kids are having because of deficiency. If they are having mineral deficiency, they develop hypopigmented patches. And usually it is iron and B12 deficiency. How do you identify? If iron is low, lighter patches are there. If B12 is also low, lighter patches, but this area becomes kala, darker. Yeah, this area. Mouth becomes darker with light patches. Also, if the knuckles are very dark, if the knees are very dark as compared to rest of the areas, you can say that it is a B12 deficiency. So B12 deficiency in kids will cause dark knuckles, dark even elbows, and especially घुटना, knee part is become एकदम काला. आपको लगता है मैल है, मैल नहीं. It is B12 deficiency. Okay, and this area. So if you give B12 supplement and you improve B12 and even folic acid, B12 iron, इन तीनों का absorption साथ में होता है हमारे stomach में से. So if you focus on one, the other two automatically improve. So you need to educate the patient about what foods are to be taken for B12, and sometimes you can give supplements as well. Like Neurobion I typically use if required, and I guide them about the diet as well. So that leads to clearing of the skin. So hypopigmented patches she mentions, and tonsils were enlarged, but they were not inflamed. So since they were not inflamed, it was a glandular swelling. It is a reactive swelling because the body has been sick for a long time. I did not change any medicine. I continued with pulsatilla, and aspidosperma was kept on the need basis, SOS only, which means zarbat padi to lena hai, nahi to nahi lena hai. Ferrum Phos 3x was given. It is a kind of iron supplement which I have been using for a long time. And normally people 6x use karte. I use a 3x, and I have seen amazing results. Another clinical tip I would like to give. In pregnant women who are not able to tolerate iron, you can give Ferrum Phos 3x, TDS, BD or QID as per the iron levels for whole 9 months. They will not have any issues. They will not have any constipation, and the iron levels will be maintained. Besides that, you educate them about the diet. So this was our case. Okay. आगे का follow up में नहीं बता रही हूँ because we continued some of the remedies. For example, last week again the same child, she fell sick. She was traveling. She got mild fever. So for that mild fever, we gave biocombination number 6, which is one of my favorite medicines for normal flu, normal common cold and flu, and mild fever. Biocombination 6 I use, and it is very effective. It works wonders. If the fever is very high and going on for more than 48 hours, I ask them to come and meet me. Sorry, and then I give them a proper prescription. But most of my pediatric patients, the parents keep a pack of medicines at home, because I'm sure you all have noticed, I'm sure we all have kids, most of us, that kids will fall sick at late night. आधी रात को बुखार, जो भी होता है रात को होता है, vomiting होती है रात को, सब कुछ रात को होता है. So I tell them to keep packs, smaller packs at home always, even if they're traveling and when they're coming back from travel. So that is when the kids will fall sick most of the time. So they'll keep at home and they will use in emergencies, and the next morning they'll come to me. Dr. Krupali, am I going too fast?
Ma'am,
No, ma'am.
it's fine. It's fine.
Okay, great. I usually speak very fast, so if something is there, you just tell me.
Sure, ma'am.
Case number 3. This is okay. Ved, Master Ved. Oh, this is a case of an infant. He is 1 month old, and he came to us with neonatal jaundice, physiological jaundice. But it has been 1 month, yet the bilirubin levels are not going down. It is still 17. So that is when the patients decided to, the mother decided to come to me. Now, the mother of, in fact, the whole family is my patient. The mother was our patient for infertility. She had high prolactin, She was having infertility, and for various complaints we treated her. Then she conceived naturally and the pregnancy went really well, except for there was a delay of 2 weeks. She was 2 weeks behind her time, so late conception hua tha. So that was the only there. And incidentally, the mother is a calcarea calf constitutionally, so it is expected some delay in the growth. Anyway, the child is also almost a calcarea, I feel so. So this physiological jaundice was there, and he had curdled particles in stool, tendency to cold since the time of birth, and the pediatrician was saying it is stridor. Stridor is a simple term for the blockages of the nasal passage. And curdled milk he will take out very often. He has a reflux issue, and he makes these grunting sounds because the nose is blocked. That's why he's making grunting sounds. Now, if you open the repertory and see the rubric, snuffles in children. Snuffles means this, snuffles in children. One of the top remedies is, I'll tell you now. See, you can see the conjunctiva, it is very yellow, and the lab report is attached, 17.45 bilirubin levels. I think you all can see. Okay, so my prescription was Nux vomica. Now, Nux vomica, why it was given? I'll tell you. First, snuffles in children. The child has a cold since he was born. Second, Nux vomica covers the jaundice in infants. This is given in repertory also and material also. So this was my prescription. And then the reflux, tendency of reflux, vomiting, food particles in stool. Again, that is covered by Nux vomica. So we gave Nux, and jaundice reduced after a week, but conjunctiva was lighter. Okay, more than a week, almost 13 days ho gaye the, and he was better, no doubt about it. But still, I did not find the result as per my satisfaction. So I decided to give a Nux 200. So one pill dissolved in breast milk, given 3 times a day for 15 days. उसके बाद ये केस खत्म हो गया. उसके बाद हमने कुछ नहीं दिया. The child is fine. But आगे की स्टोरी बताती हूँ. Jaundice तो ठीक हो गया. Digestion is fine. Reflux episodes were occasional. Occasional means कभी-कभी overfeeding के बाद he used to puke a little. Now this child is around 1 year old. Recently, the mother said that the child has a very bad nose block. उसको बार-बार nose block हो जाता है, and it's a very difficult. And then we used Nux vomica again. It did not help him. We even tried Nux in LM potency. It did not help him. I was very confident about my prescription that Nux is there. Then we took the history again. Now the child is 1 year old. Now we can take some history, right? We have some characteristics. Earlier in a baby, we don't have any characteristic. We can have only objective symptoms. So now we had some subjective data also. So it is not in the slide, but I'm telling you verbally. The child is very chubby and very hairy. उसको बहुत बाल है body पे. Very hairy child. Even he has hair on his cheeks. He will always sleep on his abdomen. Tummy के ऊपर ही सोता है. And slightly constipated, for which we had given calcarea carb like the mother. Mother ने अपना medicine use किया था. And he was okay with that, I think. But for the nose block, calcarea has not helped. Nux has not helped. So we were looking for a different remedy. The child is very hot. उसको बहुत गर्मी होती, he sweats a lot. Even while feeding, he will sweat over his face. Super hot baby. And sleeping on abdomen. In spite of the nose block, he still sleeps on the abdomen. And then I went through the repertory. I found a very nice rubric. It was a single medicine rubric. I saw only 1 or 2 remedies, one remedy in this rubric. It was nose obstruction obstinate. Nose obstruction, that is blockage, obstinate. इतना obstinate है कि किसी भी दवा से ठीक नहीं हो रहा है. So I decided to give him medorinum. So we gave medorinum 30. And to our surprise, he immediately responded. Immediately his grunting, blockage stopped. He was sleeping peacefully, having milk peacefully, and he was much better. His visits to clinic had stopped. So what was the reason for giving medorinum? First, I found his rubric. Nose obstruction obstinate. Second, very hairy. Medorinums are very hairy. उनको बहुत बाल होते हैं body पे. Chubby and very hot child. ठीक है? And उसके अलावा thick discharges, even medorinum covers that, thick discharges. So these are the few indications of medorinum. And after this thing, I was able to apply medorinum in another 3 or 4 cases. These were cases of adenoids. They had adenoid hypertrophy, the kids, and they were not responding to the indicated remedy. For example, one child was phosphorus, other one was sulfur or something, but they were not responding to the indicated remedy. So I decided to give medorinum for 1 or 3 days sometimes, depending on the symptoms. Sometimes I give single dose, sometimes I give 1 drop and a tiny bottle for that they can finish in 2 or 3 days. And then I call them back to check if they are better. So I found it very useful in the obstinate cases of nasal congestion, which were not responding to the indicated remedy. And as per Organon and Materia, nosodes are usually applicable when you don't see a result with your indicated remedy. Then you can employ a nosode. So this is how medorinum came into picture. Before that, I was not using medorinum in nose block cases. I was using it only in cases of chronic UTIs and infertility, and I was using it in asthma cases and all that, but not for the nose blocks. This is something I learned recently. Anyway, next case. Case 4. Okay, Ira. So this is a small child preschooler again. She had a high fever, 101 plus, and hands were cold, legs were cold, head was hot. She was talking during fever, loquacity during fever. She vomited in the morning. She vomited phlegm, and headache is there in the morning. And at night, she had fallen and banged her head, and blood streak mucus was there from the nose once. So all these symptoms were there. And I think the prescription is quite evident. Head is hot, but the hands are cold in fever. सिर गरम है, हाथ ठंडे हैं. Loquacity during fever and sudden high temperature. एकदम से आता है, sudden high temperature. And she had fallen also. Maybe because of fear, she fell down and she developed fever after that. कि वो गिर गई, डर गई, ऐसा भी हो सकता है, या she must be having a nightmare or something like that. The prescription was, I'll tell you now. Plays well once fever is gone, appetite is low, thirst is good, thirsty during fever. Left tonsil is showing a pustular area. Okay, I'll show you the picture if possible. And she also had a severe coughing on 3-4 दिन पहले. She had jelly, colored jelly, and she had cough after that, and she developed tonsillitis after that. And now we can see the pustular area in the left tonsil. This is the picture. You can see here this whitish deposit that you see. This is the, you all can see pustular area. अभी इसमें बहुत थोड़ा सा दिख रहा है, but it was a little more than what is seen in the picture. So the tonsils were infected with this kind of state. My prescription was belladonna 1 ml. So belladonna का ये keynote है. Head is hot, hands are cold. Child is playful and active. जैसे fever उतरा खेलने लग जाते हैं. Usually all kids are like that, but belladonna is super active. आप बोल ही नहीं सकते कि वो बीमार था थोड़ी देर पहले. Another thing that I've seen in belladonna children, they refuse to eat. If they are sick, they will refuse to eat. नहीं खाना है. मना ही कर देंगे. No. They will sometimes refuse medicine also. नहीं पीना है, दवा नहीं लेना है. Even homeopathic medicine. Belladonna becomes so obstinate. They become violent also sometimes. Head banging I have seen. Belladonna kids will bang their head sometimes. They are so upset. So belladonna has these features. So we gave belladonna and she was better. And appetite was better. Fever उसके बाद आया. हाँ. उसके बाद 5-6 दिन तक she was fine. She was absolutely fine. Parents were very happy and they informed me over WhatsApp. But on 18th April, again she got fever. High fever. And again in the morning, they brought her to me and she was very active, playful. So I decided to give belladonna 10 ml single dose. And that was it. उसके बाद वो ठीक हो गई है. She's fine now. But I had to use a higher potency. I did not change the medicine here because I was super clear about my prescription. And the constitution of the child is sulfur. So belladonna has to be. It has to be. So that's why I gave a 10 ml and single drop. and then she was fine. One more case I would like to share. It is not in the slides. I'm sharing verbally. So one day in the evening, I was at my clinic, and one couple came in a very excited. They were very excited and very agitated. What they said was, the child was the lap. It was about 6 months old child, baby, 6 mahine ka, and very cute, chubby-looking baby with nice chubby cheeks, and he was inconsolable. He said that the child has been crying for almost 16-17 hours. मतलब पिछली रात से वो continuous रो रहा है, and रो के वो गर्म हो गया था, माथा गर्म हो गया था, and he was having mild fever. We were not clear about it, but he was inconsolable. In between, they gave him something to play with. जैसे आपने उसको कोई पेन दे दिया, कुछ चीज हाथ में दे दी, so for 2 minutes he'll play. He'll be very happy and smile and play. फिर उसको फेंक देगा, and then suddenly he'll start crying. You can guess what we gave. We gave him belladonna 1 ml, one single dose. And I told them to inform me at night over WhatsApp. They messaged me that the child is fine. And he was a little restless at night. He got a mild fever, 99 के आसपास उसको fever आया रात में, हल्का सा. And already we had given belladonna, so fever was not very high. It was mild fever. And then he has been fine. अभी वो एक डब्बी belladonna की उनके पास है. जब भी वो उसको फीवर या कुछ होता है वो खुद ही दे देते हैं. एंड समटाइम दे विल कम फॉर अ रीफिल कि डॉक्टर वो वाली मेडिसिन दे दो, वो वाली मेडिसिन. चाइल्ड हैज बिकम अ लिटिल ओल्डर ना, अभी 1 साल का हो गया है, फीडिंग फेज है. सो समटाइम दे कम टू मी फॉर समथिंग, बट दिस वाज अ वेरी ऑड केस बिकॉज he was continuously crying. Even we could not take a history. He was crying so much. So belladonna is a very excitable person, excitable constitution. Face will become red, head will become hot, ro ke lal peele, and all that. One more thing I would like to share, since we are talking about belladonna. Many years ago, about 10 years ago, I had one case. He was my old patient again. We used to give him Nux for normal cold and all that, and he suddenly he came and mother said, doctor, he got fits at night, all of a sudden. And I asked her what happened. Abhi aaj tak to fits nahi aaye, fever mein bhi nahi aaye, convulsion kuch bhi nahi hua. How come he got convulsions? So mother told me that we had a Ganpati celebration. A procession was there. वहाँ पे ढोल बज रहा था और डीजे भी था. So there was light, there was noise. So probably the child got scared of he was a toddler, he was 3.5 at that time. वो डर गया बहुत ज्यादा, and रात को उसको convulsions आए. Next day evening में they had taken allopathy, just 1 dose they took, and then they brought the child to me next day. शाम की OPD में वो लोग आए, and then we understood that it was due to fear and that exposure to light and sound. सारी चीजें एक साथ हो गई, शोर शराबा, बच्चा डर गया शायद, he got fits. So we gave a dose of belladonna. अभी वो बच्चा बड़ा हो गया, he has become like 13 years old. उसके बाद कभी ऐसा नहीं हुआ है. But about belladonna, I wanted to share a little trivia. So this is it. Belladonna also talks during fever. They will be very talkative. बड़ करेंगे. Next case. Okay. So this is a case of UTI. Master Kian, 7-year-old. This child has been coming to us for various complaints since long time. Since he was a toddler, he was coming to us for sometimes for cold or fever, and sometimes for adenoids issue was there, and he comes to us for these things. This time what happened? Fever came 3-4 p.m. High fever was there, 102 degrees, shivering, likes to cover, headache, pain at the end of urination since yesterday, and today he is having dysuria all day. Urine is yellow. He is trying to hold urine sometimes. Throat was normal, tongue was heavily coated. Okay. Normally हम इस बच्चे को Merc salt देते हैं. Whenever he comes up with tonsils and fever, we give him Merc salt because उसको drooling होता है ज़्यादा. So Merc is a prominent remedy for that. Foot affection with drooling and offensive breath. So he responds to Merc salt. This time there was dysuria and urinary infection. And during that phase, during that particular month, we had a lot of kids coming with UTIs. And so I gave him Merc core. He was very thirsty, throat was dry, wet, cough was there, phlegm was there. 5 days के लिए मैंने उसको दिया. Child usually responds to Merc salt, so this time Merc core was okay. Sorry, this is a typo. This is pain at the end of urination, bloody urine today morning. So again on 28/12 they came back again. कि urine में blood आया. So end of urination, pain and bloody urine. This time I gave him Cantharis 30. So Cantharis के clear indications है. Cantharis was given. Sonography was done on the next day. We wanted to check.
Excuse me, ma'am.
Yeah.
Are you sharing the screen?
Ha, screen sharing is on.
Yes,
It's not
we all can
visible.
see the screen.
Screen is on.
Okay. Okay.
Okay.
I might be not.
हाँ आप एक बार rejoin कर लेंगे तो शायद आ जाएगा.
Yes,
Just
yes,
try
yes.
Okay. Okay.
So again, sonography was done on 29th, and PC fullness, hydroureter, mild, this thing was there. Obstruction is not there. VU reflex possibility as per sonologist. Father of the child is having renal stone and gallstone both. He used to be our patient in the past. So we did a sonography and we found this. But again, then urine routine and culture was also done. I'll share the report in the next slide. Pain continued with the urination off and on, but milder in intensity. So what happened? Cantharis was a partially similar, was partially similar to our case. It helped with the acute symptom. He's better, but urine is dark sometimes. Culture was showing citrobacter. Okay, and the child keeps touching his genitals now and then. वो बार-बार वहाँ पे हाथ लगाता है, touch करता है. Adenoids was there in the past, I told you. Sleeps only on abdomen. पेट पे ही सोना है. Hot patient है. Hyperactive है, restless है. He keeps touching things. हर चीज में हाथ लगाना. Filthy habits. Sorry. Filthy habits means किसी भी चीज को मुंह में डालना है. Putting finger in the nose or ear and then putting finger in the mouth. Eating things from the floor. कुछ भी गंदा. Dirty things he will do. So these filthy habits are there. Very few remedies are there in this room. You see the repertory and dirty, filthy. You'll see very few remedies are there. I would like you all to open repertory later on and check whatever I'm saying. And I'm sure एक बार आप पढ़ोगे तो वो आपको हमेशा याद रहेगा कि हाँ ये हमने तब पढ़ा था. So whenever such a case comes to you, you will remember. Filthy word जहाँ आता है वहाँ सबसे पहली चीज जो मैं यूज करती हूँ वो है सल्फर. Sulfur is very filthy. Although he is fastidious also, but he'll do this. Sulfur child बहुत ही गंदे होते हैं. I had one case. He was an older child. Older means 5 साल, 6 साल, 8 साल, अलग-अलग age पे वो आता था. He used to pee anywhere. कहीं पर भी सुसु पॉटी कर देगा. मतलब and he will laugh then. हंसेगा बाद में. तो हम इसको sulfur देते थे usually, and occasionally because of the teasing habit, occasionally we used hyoscyamus. When he had cough, we used hyoscyamus because of this teasing habit. Anyway, coming to this case. So this time, since the infection was becoming bacterial and chronic, and we again took the history, made a new totality, we gave him Medorinum 200. So whenever there is a bacterial infection, kahi par bhi, especially in the urinary area, the genital area, fallopian tubes, cervix, anywhere, Medorinum and Thuja, these are our top remedies. सबसे best remedies है जो frequently indicate होती है. I am not saying that they are applicable in 100% of the cases, but they are applicable in majority of cases. And try this, you will know what I mean. So Medorinum was given based on what? Bacterial infection, chronicity. Now it is becoming chronic now. It has been 3 weeks. Adenoid का history है, sleeps on abdomen, and this hyperactive child. Medorrhinum kids are hyperactive. They are full of energy, very passionate, and they have a tendency for masturbation also. So this touching genitals, it could be due to UTI, but the mother said that कि वो करता ही है, हाथ लगाता ही है. So this led us to Medorrhinum. And उसके बाद हमने दिया, और ये मैं आपसे reports share करती हूँ. So if you can see, थोड़ा font थोड़ा छोटा है, but यहाँ पर आपको दिखेगा Citrobacter infection is seen, and then in this other report, no growth is seen. Okay, so these are the lab reports, and Medorrhinum के बाद case clear हुआ, and then we tapered it off. Tapering मतलब after 1 week, I told them to give it for another 15 days, only twice a week. Daily नहीं, but twice a week. Like Sunday को दिया, फिर Thursday को दिया. ऐसे करके 15 दिन और दिया. Why we give this? Because gram-negative bacteria are like that. They take time. Gram-negative infections will not go easily. For example, E. coli. आपने देखा होगा, small girls are always coming with E. coli infections. It's very common. E. coli actually हमारी gut में होता है. So fecal soiling की वजह से वो urethra में enter कर जाता है, और E. coli infection एक बार हुआ तो बार-बार होता है. Female patients will often come to you with E. coli infection, Escherichia coli. I often use whatever indicated remedies there I give, and then side by side, in some very obstinate cases, in adults and children both, I have used E. coli ka 30 potency ka nosode. So this nosode is available in very limited pharmacies. I buy from one place in Bangalore. They have this nosode, and in so many cases I had given this. Then there are other cases जहाँ पे every time new bacteria comes in. अभी Citrobacter है, कभी Klebsiella आता है, कभी E. coli आता है, अलग-अलग आते हैं. वहाँ you need a strong nosode. Nosode will clear the case. ठीक है? ऐसे केस में tinctures useful है, but ज़्यादा काम नहीं आते हैं. You need a nosode. Because the gram-negative bacteria will leave a mark on the body. They will come back again. They will leave a mark, they will come back again. Gram-positive के साथ ऐसा नहीं है, but gram-negative are like that. So some even to like tuberculosis, ये सारे gram-negative bacteria जो है ना, ये हमारी life hell बना देते हैं. So you have to tell the patient that recurrence is possible. Whenever it recurs, you come to us, we'll give medicine. Don't take antibiotic. If you take antibiotic again and again, your immune system is further lowered. And later on, you see, अभी देखो ये report आप देख रहे हो. This bacteria is sensitive to so many antibiotics. But later, when the infection becomes more chronic, this sensitivity becomes less. They become resistant to all these. I have one case. This guy is old individual. He is 65. He has been having UTI and kidney failure. And उसकी जो culture report आती है ना, उसमें he is resistant to all the antibiotics. Why? Because he has taken too many of them. तो एंटीबायोटिक रेजिस्टेंस होता है, इसलिए आप पेशेंट्स को बताइए कि जैसे जैसे ये सेंसिटिविटी का आप ये देख रहे हैं ना डेटा, ये जितना कम होता जाएगा उतना आपका पेशेंट खराब होता जाएगा. His life will become hell. So we have to see that we give homeopathy, we give a good strong prescription, so we don't reach that stage. Right now the bacteria is weak, it is sensitive to all the antibiotics. Right? Later on it becomes stronger, immune. So this was the case of UTI. Okay, next case. Okay, Ajit. So this was the case of May 21. जब भी हमारा डेल्टा वेरिएंट चल रहा था, hospitals were full. There was no space in hospital. So this child is my old patient. He used to come to me when he was a baby. After 2 or 3 years, they came back. Many years, they came back to me. And they said, Doctor, एक हफ्ते से तेज बुखार है और दवाइयां दे दे के हो गया. एंटीबायोटिक के 2 कोर्स हो गए. Ibuprofen, Meftarjesic, सब कुछ दे दिया. Tonsils were badly inflamed and there was pus in both the tonsils. And the pus was in the form of web. एक जाला बन गया था टॉन्सिल के ऊपर. Unfortunately, I lost that video in my old phone. क्योंकि ये पुराना है केस. I lost that video, but it was seen in the video that there was a web of pus on both the tonsils. They were badly infected. The odor was horrible, and nausea was there, vomiting, coughing, heavy breathing during fever. phlegm was there, patient was chilly, was perspiring, he needed hot water, nosebleed ho gaya tha, and ear pain, eye pain, offensive breath, dullness, drowsiness, and he was falling like this. And normally this child is very happy and playful child, but he came to me in such a state. And then okay, so I gave him Merck Sol 1M. Earlier when he was small, I used to give him Merck Sol. So this time again I gave, but the fever was bad. Fever was not going, and the child was still drowsy, and they messaged me in the middle of night that the fever is 102, 103, ऐसे. So I decided to give him Pyrogen 1M. Pyrogen I used very less. I use it very infrequently because we don't find that bad stage, right? Usually the kids will respond to antibiotic if the fever is high, or they come to us, they don't develop that much of bad state. But this was in a very bad state. The parents were extremely scared because there were no beds in the hospitals. They could not even admit him. Admit करने का scope ही नहीं है, and they were like begging, doctor please कुछ करो, admit नहीं होना है, hospital मिलेगा भी नहीं. Literally they begged me. So it was a Sunday. मैंने बुलाया उनको क्लिनिक पे, क्लिनिक was closed. I still called them. मैंने उसको पायरोजन दिया. पायरोजन दिया हमने. I gave it for 3 days, but okay, this is the fever chart you can see. 16 तारीख का पहले 100 तक आया, फिर वो उसके बाद 99, 99, 100, 98, and then it went down, and then there was no fever. So 16 और 17 का चार्ट है यहाँ पे. You can see child was fine. इस बच्चे का वीडियो है, अब मैं आपको एंड में वीडियोस दिखाती हूँ. एक वीडियो है मेरे पास, ब्रीदिंग, हेवी ब्रीदिंग, रेस्पिरेटरी डिस्ट्रेस हो रहा था उसको, and even stridor was there, noisy breathing was there. So we can see that case. Now coming to Pyrogen. So Merck group of remedies almost works like an antibiotic, almost. You see bacterial growth, if you see thick phlegm, you see inflammation in ENT area, naak, kan, gala, throat pain radiating to ear, difficulty in swallowing, salivation, lot of thirst. ये Merck के keynotes हैं जो हम सबको पता है. So if you remember the keynotes, you can prescribe within minutes. But then there are states which require something even superior. Like in this case, it was so bad that it needed a nosol. So Pyrogen came into picture. Pyrogen came. Keynotes बताती हूँ मैं आपको. Loquacity during fever है. Drowsy है लेकिन बड़बड़ भी करता है. This is also there in Pyrogen. How do we differentiate belladonna from Pyrogen? Pyrogen बड़बड़ करके भी डल है. Belladonna fever में बड़बड़ करता है but playful भी है. Okay, that is the difference. Plus अभी हम तरबूज काटने के लिए तलवार नहीं निकालते, तरबूज काटने के लिए हम छुरी निकालते. Same way, directly we don't jump to a nosol. We give the mineral group. We will use the हमारा plant group, plant kingdom. अगर वो नहीं काम करा, then we go to a stronger level like animal group, or then उसके ऊपर क्या हुआ, nosol. So Pyrogen is a nosol. So since he was not better in 4-5 doses, and it was a very toxic state, मतलब उसकी शक्ल ऐसी हो गई थी कि मतलब it was toxic. That's why we give Pyrogen. Pyrogen के और क्या indications हैं? Like very similar to Merck here, Pyrogen is very offensive. The odor from the body and mouth especially is extremely bad because it is like almost like a septic. आपको ऐसा लगेगा intolerable stench. So Merck में भी bad smell आती है, लेकिन Pyrogen में उससे भी worse है. डिफरेंस ये है, Merck को ड्रूलिंग सलाइवेशन है, Pyrogen का माउथ में ड्रूलिंग सलाइवेशन नहीं. They have a dry mouth. And Pyrogen is drowsy, बिल्कुल पड़ा हुआ है. Comparable to Pyrogen is gelsemium sometimes and acid phos. So you have to check about the thirst, desire, offensiveness वगैरह वगैरह, and the state. यहाँ पर हमें pus दिख रहा है. We see pus, that is sepsis. That's why we picked up Pyrogen, not any gelsemium or any other medicine. Okay, we can think of gelsemium also for this kind of a thing, but the fact that there was sepsis, we picked up Pyrogen. This is how we differentiate. कि हमने keynotes भी देखे, हमने physical journals देखे, हमने pathology को भी देखा. Okay. ये तो fever chart था. Next case. So this is the 13-year-old child. He's also our old case, and normally हम इसको cold congestion वगैरह के लिए he's a lycopodium child. Lyco का acute होता है pulsatilla. So in acutes we have been giving him pulsatilla for a long time. आता है, लेता है, ठीक हो जाता है. Occasionally he needs Blata orientalis. Occasionally. So this time, now one curious thing about this case. This guy is going to Nagpur, to his grandparents' place. Every time he goes to Nagpur, he falls sick. Whenever he is Pune, he is getting normal cold only. But जब नागपुर जाता है, तो उसको wheezing वगैरह होती. So this has happened a few times. So they came to me, they took a refill and they went to Nagpur. वहां जाके वही हुआ. They called me, डॉक्टर ये हो रहा है, wheezing हो रही है, सिर्फ नाइट में हो रही है, डे में कुछ नहीं हो रहा है. Flaring of nostrils. Nostrils are flaring, typical lycopodium. But lyco has not helped. उन्होंने देके दे दिया था. Lacrimation in the morning, cough in the evening, thirstless. Patient is not complaining. He's saying, I'm fine. मुझे कुछ नहीं हो रहा, I'm fine. Now he's a 13-year-old child. Normally इतने बड़े बच्चे अपना complaints को पता. But he is not saying anything. He's just saying, I'm fine. So, एक तो I am fine, no complaints. दूसरा, respiration difficult, night only. Breathing stops at night only, not in the day. Pulse was given, it did not help, we left it. And then they called me again. Then my second prescription was opium. Now, I had never used opium for a case of asthma. Opium I have used in few psychiatric cases and couple of cases of very obstinate constipation. Very obstinate constipation was there. And there was one case of opium abuse. So hardly, maybe 6 times in my whole career, I have used this medicine, opium. Maybe 6 or 7 times. But this was unique situation. So, and it worked like miracle. Next day the child was fine. दिन में तो उसको ऐसे भी कोई problem नहीं थी. रात को वो सोया, he was fine. इसके बाद मैं आपको वीडियो दिखाती हूँ इसका. I'll stop this share and I'll show you the video. I'll go to the downloads.
Yes, ma'am.
वो शेयरिंग का विंडो नहीं आ रहा है.
आपने डेस्कटॉप पे लिया वीडियो को?
हाँ, डाउनलोड में है, मतलब फोल्डर में है.
नहीं, फोल्डर में नहीं, आपको उसको डेस्कटॉप पे लेना पड़ेगा.
अच्छा, ऐसा. Just give me 1 second, I'll do it. ओके, डेस्कटॉप पे आया.
Now you go to the right click.
हाँ,
Share option is there.
एक सेकंड. शेयर ऑप्शन है पर उसमें जूम पे शेयर करने का ऑप्शन नहीं आ रहा.
एक मिनट.
स्क्रीन पे जाती हूँ एक बार.
आप एक बार ऑन कीजिए, आपका डेस्कटॉप ओपन कर लीजिए.
हाँ, अभी मैं शेयर
तो
स्क्रीन
आपका जूम मिनिमाइज कीजिए और आप वीडियो ऑन ओपन कीजिए. यस, अब आप प्ले कर दीजिए इसको.
Yes,
Yes.
I am. So if you can see how the chest is going up and down. ये दिख रहा है आपको? So this child is having asthma only during sleep. In the daytime, he's fine. This is the last case we were discussing, in which we gave opium. Very nicely he is sleeping. कोई तकलीफ नहीं है. Only parents are distressed. The other case, the pyrogen case, I'll just show that also quickly. Pyrogen case वाला दिखाती हूँ.
Ma'am,
It's
just
called-
close this one. You
Yeah.
just stop this video and then you can share the another one.
Yes. So this was that pyrogen case. If you can see, the chest is moving up and down. During fever, he is having respiratory distress. Stridor, I don't know if you are able to hear. There's noisy breathing. Sleeping nicely, is very drowsy also. ठीक है. अब भी मैं वापस पावर पॉइंट पे आती हूँ अपने.
जी मैम.
Okay. Current slide. Okay. So we saw these cases: flaring of nostrils during episodes, wheezing at night, opium. Now we have seen all the cases. One more case I wanted to add was the acid phos case. I think this was a COVID case of a child. For she's a 3-year-old female. They have treated her mother during whole pregnancy for diabetes, hypertension, herpes, thyroid. For everything, we have treated her mother and father also. So this child has never taken allopathy medicines. This time, usually we give common medicine, Epicac, Pulsatilla for cold cough. This time she had fever for 5 days, high fever. And she was having initially vomiting. Then she developed diarrhea. Then we gave China 200 was given. Diarrhea reduced, but it came back again. On the day 5, finally, the patients, we were losing patience. 5 दिन हो गए, ठीक नहीं हो रहा है. They trusted me like anything. So I'm thankful that they trusted me so much that they waited for 5 days. Finally, they told me she's only having orange flavor का Glucon-D. इसके अलावा वो कुछ भी नहीं ले रही है. और high fever and she has become drowsy. Normally she is very playful and active child. But she has become drowsy and orange flavor Glucon-D के अलावा कुछ नहीं खा रही है. Diarrhea has been there for a few days. She has become weak, high fever. So usually I don't use acid group remedies in children. Typically use नहीं कर, इतनी काम नहीं आती है. But I gave her acid phos. What was the indication? Desire for juice, refreshing thing, cold things. So acid phos का ये सबसे बड़ा keynote है. Plus, after an episode of diarrhea, body is very weak. You become weak, drowsy. You have lost all the fluids from the body. So recovery is also slowed down. So ये जो state होती है उसमें typically we use 3 remedies are there. After fluid loss, China is there. China we had given, it did not help. Then there was arsenic. Arsenic is also there. But arsenic के कोई और features हमें नहीं मिले. The keynote that we found was desire for that orange flavor, Glucon-D or orange juice, whatever. It led us to acid phos, and after single dose, next morning she was fine. रात को हमने around 8 o'clock we gave one dose. उसके बाद रात में I don't know if they repeated or not, but in the morning I got a message the doctor she's fine, पूरी रात fever नहीं आया और अभी उठी है. And then later on she messaged me, mother messaged me that there is no diarrhea, she's fine. One day there was no potty because her intestine was empty. Then she started eating and then next day she had normal. So talking about the guidelines, general guidelines for managing the acutes, it should be very clearly told to the parents, attendants, whoever is coming with the patient. General guideline means आपको डाइट क्या देनी है, फीवर के टाइम आपको क्या पहनाना है, क्या ओढ़ाना है, फ्लूइड्स कितना, हाउ डू यू मेक द चाइल्ड मोर कंफर्टेबल. अभी कई पेरेंट्स को ये नहीं पता होता. अभी हम पूना में रहते हैं, पूना में यहाँ पर ज्यादा ठंड नहीं होती है, बट स्टिल सम पीपल विल मेक देयर किड्स वेयर बॉडी वार्मर्स. बॉडी वार्मर्स की नीड यहाँ पे नहीं होती है, इट्स एब्सोल्युटली नॉट रिक्वायर्ड. यहाँ पे उतनी ठंड है ही नहीं. You barely need one single sweater. If you're going on a two-wheeler or something, you might need earmuff to cover your ear. That's it. But then still people are making the kid too warm. Body warmer pehna diye. So फिर fever will rise more. Child will develop rashes on the body. Right? A lot of kids develop rashes after fever. Sleeping position. If the child is not able to breathe, not able to have milk, then we have to explain the feeding position to the mother. या आप उसको कैसे लो, आप कैसे उसको होल्ड करो, बेबी को किस पोजीशन में होल्ड करना है, आर्म के ऊपर रखना है ताकि उसका हेड एलिवेट हो, आप आर्म के नीचे पिलो रख सकते हैं, आप अपने थाई के नीचे पिलो रख सकते हैं. ऑल दीज थिंग्स यू हैव टू एक्सप्लेन एज अ डॉक्टर. एंड एज अ फीमेल डॉक्टर यू शुड बी able to guide your patient about breastfeeding as well. They expect this from us कि आपको ये तो आपको मतलब डॉक्टर बता सके हमें, because there are very lot of myths around breastfeeding also. They are not able to feed, they will become irritated, they will cry, they will give formula quickly. So if you are a doctor and especially if you are a mother, you should be able to guide them about breastfeeding, feeding position, quantity and other things. So I would urge you all to educate yourself about this matter because it is very important, it is very relevant to our relevant in today's time. So then making the child comfortable, massage है, ये करना है, पैर दबाना है. बहुत से बच्चों के पैर दुखते हैं fever के time. Pulsatilla kids will have a leg pain during fever. Ducks will have a headache during fever. China को भी बहुत headache होता है, drowsy हो जाते हैं. Arsenic will have cold hands and feet during fever. So आपको massage करना है, थोड़ा comfortable करना है उनको. Fluids कितना देना है. I wanted to show a case of dengue also, but there were already too many cases. So dengue के case में especially आया, किसी भी high fever के case में, when the body pain is tremendous and patient becomes weak and even fainting is there. Dengue में तो लोग faint भी हो जाते हैं because of this thing. So you need to tell them to have around 150 to 200 ml liquid per hour. एक घंटे में आपको इतना fluid लेना पड़ता है. The waking hours, not in the sleeping hours. So गए तो आप disturb मत करो, but in the waking hours most of the time 150-200 ml fluid जरूरी है. Otherwise उनको hospitalize करना पड़ेगा just for giving fluids and you will lose on that case. Then हाँ, तो fluid intake के बारे में मैंने बताया. Sometimes we need steam. Now if the child is having a nose block, वो steam कैसे लेगा? मुंह से लेगा. You have to tell them to give the steam by mouth. Saline nebulization मैं permit करती हूँ. I tell them if you have a nebulizer, उसमें saline water डाल के उसका nebulize करो आप, and via mouth, so that the nasal passage will open up. Otherwise, if you try to breathe through the nose is blocked, you will end up with a headache or even a ear pain. Snorting नहीं करना है. Snorting नहीं करना है. You have to tell the parent to teach their child to blow the nose, to take out the mucus. Otherwise, they will come to you with a ear pain. Ear pain लेके अगले दिन आ जाएंगे. Then what kind of a diet is suitable for a throat infection? कौन सी diet देनी है आपको? Soft देना है, boiled food देना है, palatable food देना है, spicy नहीं देना है. Sometimes we give moist food like दूध, roti and such things. And something like soft like potato, sweet potato, ऐसी चीजें हैं. इसके अलावा जो मैं चीजें strictly avoid करने के लिए बोलती हूँ, जैसे food colors है, chocos है, things that are made from palm oil, जैसे Kellogg's के chocos, they are made from palm oil. शुगरी फूड्स हैं, हर्शीज के सिरप है, ये काफी पॉपुलर, जैम है, ये चीजें बच्चे बहुत खाते हैं। कलरफुल कैंडीज, आई डोंट अलाउ कलरफुल कैंडीज, आई टेल देम टू अवॉइड। फूड कलर वाला कुछ भी नहीं खाना है, पाम ऑयल वाला कुछ भी नहीं खाना है। भले ही पेशेंट्स को ऐसा लगे कि डॉक्टर कितने स्ट्रिक्ट है, कितना मना करते हैं, but as a parent you also know that these are all junk food, they are toxins for our liver, and these days all the half of the population is having a fatty liver, so we have to stop all the palm oil नहीं लेना है। बच्चों को जो स्नैक्स देने हैं तो पेरेंट्स हमसे पूछते हैं क्या स्नैक्स दे सकते हैं, so we can give only homemade snacks like खाकरा है या मुरमुरा है, पॉपकॉर्न है, सिंपल पीनट्स है, ऐसी चीजें जो होममेड है, घर का है, चना है, यू नो, जिसमें कुछ फ्राइड, हार्डली फ्राइड है, या घी में आप कर सकते हैं, ऑयल नहीं है, फूड कलर नहीं है, प्रिजर्वेटिव नहीं है, सच थिंग। ये आपको स्पेशली उन बच्चों को बताना है जिनको रिकरिंग थ्रोट, लैरिंजियल कंप्लेंट्स, चेस्ट कंप्लेंट्स, यूआईटीआई, ये सब है। ग्लूटेन मना करते हैं हम ड्यूरिंग डायरिया, इवन मिल्क वी टेल देम टू हैव लेस मिल्क ड्यूरिंग डायरिया, but yes, infants can have milk because they have no other option. For fussy kids also you have to tell them diet. Sometimes the parent will say मेरा बच्चा कुछ नहीं खाता है, so you have to tell them some diet ideas. Okay, offer something crunchy, डोसा बना दो, चीला बना दो, पूरी तल दो, you know, such things. If the kid is fussy, then they like to have some fussy food also, right? Simple roti नहीं, पूरी खाएंगे, such things. So it's a part of the treatment that you have to guide the patients about these things. Diet and regimen आपको बताना है उनको, because if they keep giving the wrong foods to their child, the child will develop allergies, he might become deficient, and they keep coming to you. And what they will say, homeopathy से ठीक नहीं हुआ. So it is important that we eliminate those things which are triggering. For example, the allergens. I am not talking about the नॉर्मल चीज है। कभी कभी मैं आइसक्रीम पे अलाउ करता, आई टेल देम कभी कभी आइसक्रीम खाओ, कुल्फी खाओ, इट्स ओके, बट मल्टीप्लेक्स में जाके कोल्ड ड्रिंक मत, बिकॉज इट इज फुल ऑफ आइस एंड कोल्ड ड्रिंक इज जंक। वी ऑलरेडी स्पोक अबाउट दैट। एक चीज मैं ऐड करती हूँ, एक्सोटिक फ्रूट्स दोज आर कमिंग फ्रॉम डिफरेंट प्लेसेस, एक्सोटिक फ्रूट्स आई डोंट अलाउ। उसका रीजन ये है, they may be high on preservatives, they may be high on pesticides, which is bad for you and me also. A lot of kids are allergic to cakes, chocolates, and candies. Cali group and pulsatilla and sulfur, tuberculinum also. These are some of the common remedies that we see for food allergies, especially pulsatilla. Pulsatilla को candy और pastry से allergy होती है। Candy और pastry खाने के बाद उसको गला खराब हो जाता है। क्या? नक्स को खांसी, कंजेशन होता है, या रिफ्लक्स और खांसी होती है after having spicy food. So we need to learn all these keynotes and triggering factors also. Ailments from what? Ailments from watermelon, ailments from stale food, ailments from something spoiled food खा लिया आपने, है ना, या मीट ज्यादा खा लिया, ऐसे कुछ है। जैसे अभी I have one case, this child is having a cough, reflux cough he has. So उसको fish, meat, ये जो भी नॉन वेजिटेरियन फूड है उससे है। So we are giving him Naxomic and he is showing good results, and it's a very chronic case. Sleep and waking routine. The child should have a sleep and waking routine, maintain the health. Too much of screen time, laziness, not going out to play, avoiding sunlight, not going in fresh air, and poor sleep schedule. This will make the child sick. Sometimes it will make the child constipated also, and they will come to you with something. Emotional triggers for sensitive. And we don't have time today, otherwise I would have shown you some more cases. We had one case, this child developed convulsions after being scolded. That पड़ी तो fits आ गया उसको, 2 बार ऐसा हुआ उसके साथ. We had given her Ignitia. She is fine now, since long time she's fine. So hitting, overexcitement, yelling, dispute among parents, horror content on media, and too much scolding, fear, ये भी बच्चों को ट्रिगर करता है. You need to know these things so that you can prescribe better. Fear और scolding के cases में मैंने Ignitia और Staphysagrina काफी बार यूज करी है. हॉरर कंटेंट देखने के बाद बेड वेटिंग या ऐसे कुछ कंप्लेंट्स में I have used belladonna, and I've used arsenic and calcarea group, calcarea, and dispute among parents. इसमें मैंने use करी है all the timid remedies, calcarea, silicea, natrums I have used. These are some of the remedies which are useful as per the ailments from. So you need to know these keynotes, otherwise you cannot prescribe. Counseling and calming down anxious parents is very important, because usually parents are very anxious, especially if they're first time parents. उनका एक ही बच्चा है, एकलौता, so they're always very excited, especially the mothers. So you have to calm them down. You have to explain things in detail. You have to be there to answer their queries. Sometimes they will call you for something very stupid. जैसे आज मुझे एक पेशेंट का कॉल आया, उसकी बेटी को थ्रोट इन्फेक्शन है, पस्टुलर इन्फेक्शन है. शी इज आस्किंग मी दही दे सकते हैं क्या? I know it is common sense कि आप खट्टा मत दो, ठंडा मत दो, दही मत दो, but still she called me. But sometimes you have to entertain, because हम फीस लेते हैं, थोड़ा सा हमें entertain करना पड़ता है. You have to tell them about vaccination also. Which vaccine is harmful? Which vaccine can be avoided? It is not mandatory to give. अभी flu vaccine का काफी advertising हो रहा है, useless है. So you can guide them about that. Okay, you have to be there for them. If you are not being there for them, you are not available for them, they will not trust you with the kids. Pediatricians और gynecs कुछ एक प्रोफेशन ऐसे होते हैं जहां आपको हमेशा अवेलेबल होना पड़ता है. रात को भी आपको कई बार कॉल आता है. Just be there, okay? Because we are dealing with humans, we have to have the compassion. आप कोई IT जॉब नहीं है कि आपने 6 बजे लॉग आउट किया उसके बाद बस, ऐसे नहीं है. As a doctor, as a mother, we have to have that compassion and be there sometimes at odd hours also. And then it makes the patient very, very happy. They'll thank you for that. कि नहीं doctor आप हो, you are there, so we are not worried. ठीक है? Sometimes Sundays को आपको आ जाता है कि Sunday को आ जाओ. If possible for you, make an arrangement. आप नहीं जा पा रहे हो, make an alternative arrangement. These things are there. So with that, I end my presentation. So if you have any queries.
Ma'am, stop the screen sharing, please.
Yes, I'll stop the sharing. Yeah.
So there are few questions in the chat box. Let me ask you very precisely. And then Dr. Krupali also got some personal questions for you from some of the colleagues. So she will ask them. Okay. Just a minute.
So this is Gibson.
Yes, one of
remedy relationship. It's a very tiny book
that I have already written for the public, so that if nobody has kept, then they can take it down. Yes. Dr. Shelja is asking, I had seen many patients about having the cold and fever, and kid took allopathic medicines regularly, and then kids developed the dry coughing after that, as like an bronchitis. After taking the allopathic cough syrup, coughing is going on, and then with the reference of someone came as first visit to me, what would be the first line of treatment to control that dry cough?
Okay. So like I said, first thing you have to take the keynotes. पहले keynotes आपको लेने हैं कि cough, जैसे type of cough, position, time. For example, abhi, there was one case I wanted to share. It was a case, a very bad case of bronchitis. He was already taking inhaler. वो inhaler पे ही था बच्चा, छोटा बच्चा है, 3 साल का. So 150 mg का वो inhaler already 4 puff he was taking, 2 सुबह 2 शाम. The modality was 2 to 4 a.m. aggravation, night में 2 to 4 a.m. Based on that alone, we gave Cali carb. There was no other keynote available in the case. Constitutional, uska carcinosin aa raha tha. Carcinosin was this constitutional remedy that was showing up.
Yes, ma'am.
But then we had to manage the acute state. I could not jump to carcinosin directly. So we started with Cali carb, and we also gave him aspergillus that time, tincture. and then we asked the patient to taper the steroid. So they took 3-4 days to taper it. 2 puff की जगह 1 puff, फिर रात का, फिर then finally stop. Cali carb 30 we gave for 2 weeks, and then again that also we tapered. अभी तो हमने बंद ही कर दिया है. Then the child developed normal cold, normal zukham with thick mucus. That time we gave him Cali sulf. Cali sulf I gave in 6x power. 6x में हमने दिया था for the thick mucus. My point is यहाँ पे I cannot give you a ready-made prescription here. You have to take the case.
Yes, ma'am.
You have to see the current modality. And you can also probe into the initial symptoms. For example, पेरेंट्स से आप जब खोद के पूछते हैं, खोद के, तो वो बताते हैं कि डॉक्टर मिडनाइट के बाद तकलीफ ज्यादा होती है.
Yes.
डॉक्टर अर्ली इन द मॉर्निंग ऐसा होता है. डॉक्टर लंच के बाद खांसी बढ़ती है खाते खाते. डॉक्टर पानी पी के सो जाते हैं या वॉमिट करके आराम मिलता है. लाइक आई सेड बिफोर, वॉमिट करके रिलीफ हुआ एंड सूखी खांसी रात में ड्रोसेरा इज कमिंग. देन कॉफ ओनली ऑन लाइंग, dry cough only on lying, रात में होने वाली hyoscyamus is there.
Yes.
Right? So such keynotes are there in our materia medica and they are in the repertory also. For that you have to take the case, note down the modalities very precisely. आपको बहुत खोद के पूछना पड़ता है क्योंकि पेरेंट्स आएंगे ना, they will tell you the whole story. डॉक्टर पहले ये दिया, फिर मैक्स्ट्रा दिया, फिर बुटेकॉट दिया. इसमें हमको टाइम नहीं वेस्ट करना. एलोपैथी दिया जाने दो. दूसरी बात, पीडियाट्रिशियन के नोट्स आप देखिए, पीडियाट्रिशियन की फाइल आप देखो. कहीं पे जो डॉक्टर्स हैं वो पीडियाट्रिशियन की फाइल देखते ही नहीं. उसमें आपको क्या मिलता है? आई टेल यू व्हाट यू फाइंड. अगर एक्जिमा सप्रेस हुआ है वो मिलता है. आपको ये भी मालूम पड़ता है, फ्रीक्वेंट विजिट्स अगर हुए हैं तो आपको ये पता पड़ता है कि पेशेंट के जो माँ बाप है वो एंशियस टेम्परामेंट के हैं और इम्पेशेंट है. आपको ये भी पता पड़ता है कि उनके साथ डील कैसे करना है. कई बार होता है ना कि वो एक दिन में आ जाते हैं. They have no patience. We have to tell them, counsel them. Then vomiting tendency is there. तो vomiting की दवाइयाँ अलग है. Vomiting में आपको इपिकैक मिलेगी. खास के वॉमिट किया, इपिकैक थर्स्टलेस चाइल्ड. ठीक है. नक्स इज देयर. खाते खाते खांसी आके वॉमिट कर देते हैं. नक्स इज देयर, है ना. रिफ्लक्स, नोशिया इज देयर. नोशिया आ गया तो फिर आर्सेनिक भी आ जाती है, इपिकैक है, नक्स इज ऑल्सो देयर. रात की वॉमिटिंग में ड्रोसेरा मैंने आपको बताई. सो देयर आर दीज रेमेडीज, सम मे बी 15 रेमेडीज. उस 15 रेमेडी में हमारे 99% केसेस कवर हो जाते हैं. तो आपको 10,000 रेमेडीज रिमेम्बर नहीं करनी. आपका 15 रेमेडीज में काम होगा, बट यू हैव टू टेक द केस. यू कैन नॉट से कि केस नहीं लिया है एंड देन एकदम से हमें मैजिकली कुछ आ जाए, ऐसा नहीं. Have to know, especially time modality. Time modality इतनी precise है, the material is so beautiful. And time modality अगर आपको मिल गई, बस case is sorted.
Okay, ma'am, one more question from Dr. Alka Patel is, what is the meaning of the medicine? You have written the prescription, medicine, and then 4 into 15. So what does mean from you?
4 pills, 4 times a day for 15 days.
Okay. Dr. Selja Thakkar again is asking, I'm working in a preschool as a doctor, and here most of the time child comes with the sudden colic without any other symptoms. Parents narrate कुछ नहीं होता, बच्चा आराम से खेल रहा है, सडनली आएगा और बोलेगा कि पेट में जोर से दर्द हो रहा है. After few minutes child is normal, no history of constipation at that time. What should I do?
Okay. This kind of crampy pain जो होता है ना, so basically cramp, इसको हम cramps बोलेंगे. So cramps in abdomen you have to see, and then you have to see the food triggers. जैसे empty stomach हो रहा है, after lunch time हो रहा है, after drinking हो रहा है, and आपको repertory में भी ये मिलेगा कि colic after eating, colic after drinking, और या exertion के बाद हो रहा है, या empty stomach हो रहा है, whatever the modality में भी, उसके basis पे you can pick a remedy. अगर आपको कुछ भी समझ में नहीं आ रहा है, if you are unclear and that time you don't have a time to take a history, तो आप बायोकेमिक यूज करिए. जैसे मैग्नीशिया फॉस, 6x पावर में मैग्नीशिया फॉस आती है, वो आपने थोड़ा सा पानी में डाल के आप बच्चे को देंगे, इमीडिएटली क्रैम्प शांत हो जाते हैं, इमीडिएटली. एंड देन लेटर ऑन यू कैन गो बैक एंड रिविजिट द केस एंड टेक अ हिस्ट्री एंड अंडरस्टैंड व्हाट इज हैपनिंग. इसके अलावा कई बार अचानक से बच्चे वॉमिटिंग कर देते हैं, वहां पर एसिडिक फील करते हैं, वॉमिट कर देते हैं, वहां पर नाट्रम फॉस इन 6x पावर वेरी इफेक्टिव. सो कुछ अनक्लियर सिचुएशंस में बायोकेमिक यूज करने में कोई प्रॉब्लम नहीं, यू कैन यूज.
Yes, so from my side, the questions are over. I would hand over the whole platform to Dr. Krupali, and whatever is questions given to her, let her ask. Dr. Krupali, you
Yes, I
can.
have two questions. Yes, I've got two questions. One was effect of parents' constitution on kids' constitutional medicine. जो parents की जो constitution होती है,
That's very good question, Dr. Krupali. बहुत सी बार जो पेरेंट का कॉन्स्टिट्यूशन है वो बच्चों में भी आता है. So many times I have given the same medicine to the one parent and उनका बच्चा. So many times it happens. Like I have a couple of cases जहाँ mother, in fact ऐसे भी उसका उल्टा भी हुआ है कि हमने बच्चे को पहले देखा है और उसके पेरेंट को हमने बाद में प्रिस्क्राइब किया है. The remedy came same because genes are same, upbringing is same. बहुत सी बार ऐसा होता है. But ये thumb rule नहीं है. You have to take a detailed history. If you are getting the prominent symptoms कि नहीं यार ये this is looking like a Beretta case and father का भी आप देखो slow responses है, आपने कुछ पूछा देर से जवाब मिला, timidity है, body language आप देखो. बड़े adult patient में बहुत सी बार हम body language से भी judge करते हैं, right? We see the body language. Patient confident है, nervous है, timid है, shy है, slow है, fast है. ये भी हमारे judging factors होते हैं, right? In fact मैं मेरे जो पूरा chronic case लेती हूँ, अभी तो आपने acute case देखे, chronic I have not seen, but we write the body language part also. तो बहुत सी बार हमको मदर और चाइल्ड या फादर और चिल्ड्रन दे गेट सेम रेमेडीज. बहुत सी बार ऐसा होता है. बट ये थंब रूल नहीं है. यू हैव, इट इज नो एक्सेप्शन. यू हैव टू टेक द केस एंड असेस द होल थिंग. ऐसे भी हुआ है कि बच्चे को हमने नाट्रम कार्ब दी है और मदर नाट्रम ग्रुप है तो नाट्रम म्यूर आई, नॉट कार्ब बट म्यूर. सो दिस हैपेंस अ लॉट. So you have to remember these things, but yes, if you know, then it becomes a little easy for you. आपका रास्ता आसान हो जाता है.
another one is yes, long COVID. We have seen few cases of low immunity post COVID. So is there any intercurrents or specific for long COVID?
So थोड़ा हम इसको bifurcate करते हैं. Long COVID के बाद I'll give you few examples. जैसे general weakness, debility, कमजोरी, थकान ये सब. I have used acid, phos, arsenic, जो debilitating remedies होती है. Avena tincture and loss of appetite है तो alpha tincture. ऐसी छोटी चीजें हमने use करी है. Then there were some cases who came with burning and heat in palms and soles post COVID. Some neuropathy like symptoms. Diabetic patient थे, neuropathy वाले symptom लेके आए, हाथ पैरों में जलन, sulfur and all these things. Anosmia वाले patients बहुत आए, loss of taste and smell. वहाँ पे मैंने दी pulsatilla is my favorite for that. And a couple of cases needed calcarea carb. Now calcarea carb also covers these symptoms, loss of taste and smell. All the carbonates are covering this symptom actually. So I've used that group. Hair fall. अभी hair fall में तो बहुत सारी medicines आती हैं. Sometimes I give something very simple like ferrum phos 3x or 5 phos in 3x, something like that. I use that. अब मुझे बड़ा मजा आता है, बड़ा अच्छा काम करती है. And thallium was used in a couple of cases for hair fall. Acid phos again for hair fall. Long COVID में acid phos सबसे prominent remedy थी. हाँ, prolonged coughing, जो coughing बहुत दिन चलने वाली थी, वहाँ पे हमने स्टैनम मेट बहुत यूज करी थी. एंड वन मोर आई रिमेम्बर, जिनको लंग अफेक्शन हुआ था, दे हैड निमोनिया और दे कंप्लेन ऑफ वीकनेस इन द चेस्ट एरिया एंड देन sinking feeling. We use tuberculinum aviare. Tuberculinum aviare in single doses. One drop, only one drop be used. This was there. And some people developed diabetes after the COVID. Diabetic cases may we have used various remedies. I personally use pancreatin in various potencies and I use this thing insulinum in various potencies. sulfur compounds and acid groups are my favorite in diabetes. That also I use. So long COVID में बहुत सारा, there's a lot. We can have a whole session on that.
Yeah. Okay, ma'am.
Yeah.
Yeah. Thanks a lot, ma'am.
Yeah. So
I think the questions are.
One more.
Krupali
ma'am, if you have further questions, you continue.
No. I have just.
Okay. So one more questions from the viewers. कफ सिरप देना चाहिए या नहीं देना चाहिए along with the homeopathic treatment?
There is no need. जरूरत ही नहीं है. If you are giving a proper prescription, you don't need any cough syrup. ऐसे पेशेंट्स है जो आके बोलते हैं डॉक्टर आपकी दवा देने के बाद कॉफ सिरप की एक्सपायरी डेट आ गई, हमने फेंक दी है. इज नॉट रिक्वायर्ड. ओनली यू हैव टू बी कॉन्फिडेंट. आपको पढ़ना पड़ेगा, आपको की नोट्स याद करने पड़ेंगे. यू हैव टू मास्टर द आर्ट ऑफ एक्यूट प्रिस्क्राइबिंग. देन देयर इज नो नीड ऑफ. आपके खुद के घर में भी कॉफ सिरप नहीं होना चाहिए.
Yes.
मेरे घर में नहीं है. वी हैव ओनली वन मेडिसिन एलोपैथी का, एक क्रोसिन का सिरप रखती हूँ मैं. That too gets expired and we throw it up, literally. And even other homeopaths who are practicing homeopathy properly, वो agree करेंगे मेरी बात पे कि हम रखते हैं पर वो expire हो जाते हैं, घुलते भी नहीं है. You
Yes.
have to have that much of confidence in yourself. अगर आप shortcut देखेंगे, और even homeopathic cough syrups आजकल आने लगे हैं.
Yes.
So I would not suggest using that. वो shortcut मत लीजिए because वो partially act करते हैं, और partially से minimum देने के बाद भी you have to have another totality. You have to redo the case again. Partially से minimum देके भी आपको मेहनत उतनी ही करनी है, तो पहली बार में सही दवा दे दो. Again, एक चीज मैं बोलती हूँ, I always tell this to my patients, कि अगर आपको 48 hours में उस दवा से रिलीफ नहीं मिल रहा है, एक्यूट कंडीशन की बात कर रही हूँ मैं, क्रॉनिक की बात नहीं कर रही हूँ, 48 hours में रिलीफ नहीं है, या आप मुझे व्हाट्सएप पे अपडेट करो, अब बताओ मुझे नहीं है तो हम दवा चेंज कर देंगे. मैं उनको पहले ही बोल देती हूँ. So when we say this beforehand, they are mentally prepared कि यार डॉक्टर है, वो दवा बदल के देंगे. आपको नए डॉक्टर के पास जाके दोबारा डबल फीस नहीं देनी है. You have to come to me. I will not charge you again. We will charge only for medicines. You give them that much of confidence कि we are there for you. नहीं ठीक होगा हमारे पास ही आओ, हम देंगे आपको.
Exactly.
And then they come back to us. ऐसा नहीं है कि they will be like, अरे नहीं हुआ अब क्या करें, अब एलोपैथी में जाओ, फिर से फीस दो, फिर से दवाइयाँ खरीदो. They will spend 400 rupees for consultation, 500 rupees. 1000 की दवाइयाँ 1500 रुपए खर्च करेंगे. और हमारे हम कितना चार्ज करते हैं? आज भी हम नॉमिनल ही, हमारे रिलेटिवली हमारे चार्जेस नॉमिनल हैं. So that again gives the confidence to the patient कि नहीं, we are there and we are not looting you, we are helping you.
Yes, very right. Ma'am, few of the comments for you. Thanks for all the sharing and very useful clinical tip. Love the general management part. So thank you, Dr. Asha, for such a grateful comment. And from Dr. Selja, thank you, ma'am, for solving my all the doubts. So here we ends with the question answer session, and I request Dr. Mona, ma'am, to further come over the platform. And okay, one more question. Sorry to interrupt, but one more questions. Let us take it. Is that
Yeah.
ma'am? Yes. Water potency में medicine देनी चाहिए या नहीं देनी चाहिए?
mean LM potency?
Water potency.
Water dose is very effective way of dispensing medicine. Sometimes in small kids, जब भी वो गोली लेने में resist करते हैं, या tinctures तो हम पानी में ही देते हैं obviously. Water dose is very effective. Even I have tried this approach कि आपने वो एक ही single dose 4 pills आपने mix करा है, और फिर spoons थोड़े करके 2 spoons 2 hourly 2 spoons, वो divided minimal dose is very effective. आप दो, no doubt about it. LM also I use in kids. मैं बच्चों को LM potencies देती हूँ, water में dispense करके. Works really well. LM मेरा favorite है. Only thing is वो dispensing में छोटी pill होती है ना, तो parents थोड़ा सा परेशान होते हैं, इसलिए मैं कम देती हूँ. I give it to the cases of eczema and asthma and the chronic ones, not the acute ones.
Okay. So I now welcome Dr. Mona, ma'am, for the thanking note for today's session. Dr. Mona, ma'am. Ma'am, you're mute. Ma'am, you're mute. Yes, ma'am.
I would like to thank Dr. Anshita Singh. Thank you so much. It was very informative information, and it was very nice webinar. And we would like to thank Stage Branch, and we would like to thank Dr. Varsha, who always support us. Varsha, thank you so much. Zoom, સારી રીતે તમારું વાપર્યું છે આ વખતે પણ. And thank you so much. We would like to thank all our friends, doctor friends, જે હંમેશા અમને સાથ આપે છે. આટલા સરસ પ્રોગ્રામોનું જ્યારે આયોજન થાય છે ત્યારે આપ સૌની હાજરીથી જ આ પ્રોગ્રામની સક્સેસ વધે છે. તો ફ્રેન્ડ્સ, લાસ્ટ બટ નોટ લીસ્ટ, તમે સૌ પણ આ રીતે એક પ્રયાસ કરો, વેબિનારનું આયોજન કરો. અને આપણે જેમ કહ્યું છે, તમને ક્યાંય પણ તકલીફ પડે તો તમે સ્ટેટ બ્રાન્ચમાં કહી શકો છો, નેશનલ બ્રાન્ચમાં હેલ્પ માંગી શકો છો. નાના નાના 2 થી 3 વ્યક્તિ મળીને પણ સરસ પ્રોગ્રામનું આયોજન કરી શકો છો. એટલે હવે આપ સૌ જાગો. અને જેમ વર્ષા બહુ શોર્ટ પીરિયડની અંદર ખૂબ જ જાણીતા થઈ ગયા છે, તેવી રીતે જ આપ સૌ પણ દરેક જેટલા અત્યારે 47 કે 49 પાર્ટિસિપન્ટ છે, તો દરેકનું નામ આ સ્ટેજ પર આવે એવી અપેક્ષા હું રાખું છું. અને આપ સૌ એટલા જ એક્ટિવ બનો. કોઈ પણ હેલ્પ જોઈતી હોય તો બધા જ આપણી સાથે છે. તો ફરી આપ સૌને અભિનંદન પાઠવું છું કે આપ સૌ અમારી સાથે છો. બસ આ જ રીતે પ્રોગ્રામને સફળ તો બનાવતા રહેશો એવી આશા રાખીએ છીએ. થેન્ક યુ સો મચ.
મેમ, હું તમને રિક્વેસ્ટ કરીશ કે જેમ કે અંશિતા મેડમે એક કીધેલું કે એમને નહોતી ખબર કે હમાઈ લેડીઝ વિંગ જેવું પણ કંઈક છે, તો મહારાષ્ટ્રમાં કે પુણેમાં કે બોમ્બેમાં જો એ લોકોને ચાલુ કરવું હોય તો કંઈક પ્રોટોકોલ કે એવું કંઈક કોને કોન્ટેક્ટ કરવું, એક ડિટેલ તમે આપી દો.
હમણાં આપણું જે લાસ્ટ પ્રોગ્રામ ગયો ને
મેમ, હિન્દીમાં હશે તો મેડમને ખ્યાલ આવશે.
हाँ, એટલે હું એ જ સમજાવું છું કે जो अभी लास्ट जो प्रोग्राम गया हमारा वेबिनार, उसमें काफी इंक्वायरी आई. और वहां पे प्रभा देवी में डॉक्टर जय लक्ष्मी ऐसा कुछ नाम था उनका, तो वो मुंबई में स्टार्ट कर रहे हैं. तो मैं इनसे भी निवेदन करूंगी कि आप भी 15 मेंबर्स को इकट्ठा कीजिए. 15 मेंबर से एक यूनिट की रचना होती है. तो आप मेल फीमेल 15 मेंबर्स को एक्टिव कीजिए और बाद में लेडीज विंग को एक्टिव कीजिए, ताकि हमारा यूनिट बहुत सक्सेसफुली आगे बढ़ सके.
Anshita, let me tell you something about HMI. Homeopathic Medical Association of India is the largest association of registered homeopathic practitioners. So first you will have to be a part of HMI. Then you can be a member of Ladies Wing. So you can encourage your, you are having your whole vast, very active study group. So you can encourage them to be a part of HMI. क्योंकि government में कोई भी licensing होता है ना, they are looking for very, very authentic or a big organization. तो कोई भी licensing जो होता है हमारी ओर से, हम homeopaths की ओर से, तो HMI के platform through ही होता है. So it will be very useful if you all are be a part, all active homeopaths or popular homeopaths of a city are a part of a HMI unit. So it gives.
इसमें ऐसा है, पुणे और मुंबई में HMI नहीं है, और बहुत मतलब कम है.
क्या मैम, वहाँ पे जो है ना वो पॉपुलर प्रैक्टिशनर्स बहुत ज्यादा है पुणे. और मैं मतलब आई एम अ पार्ट ऑफ वन पुणे व्हाट्सएप ग्रुप. सो मैं रोज आई विटनेस द यूनिटी एंड द डॉक्टर, द स्ट्रेंथ ऑफ अ डॉक्टर्स. सो वो लोग HMI अगर शुरू करे, पार्ट हो जाए, तो इट विल impact a lot.
आपको पहले HMI की रचना करनी है या HMI में मेंबर बनना है?
Yes.
Thank you, Krupali.
So
Right.
I'll share the information, all the information regarding our group membership, and you can be a part of it.
Definitely, I would love that.
Yeah, thanks a lot.
Thank you all here, and thank you for having me, and thank you for this amazing platform. I would like to be in touch with all of you, and till we meet next time.
Ma'am, just a minute.
Thank you so much.
I would like you to say a few words for new upcoming homeopaths and how they can deal with. If you can give some encouraging words to them.
Yes. Upcoming homeopaths, एक तो हम study group में तो उनको encourage करते ही हैं, but since it is a big platform, and I hope ये recording भी आगे जाएगा कहीं,
जी
will be
मैम.
useful for somebody who will, कुछ लोगों के लिए तो useful होगा. Even मैं अपने clinic में we have a lot of observers coming. At least 2-3 observers हमारे आते हैं सीखने. We don't charge them. We teach them freely. अपनी will से हम उन्हें सिखाते हैं, and हम चाहते हैं कि वो आगे बढ़े और आगे purely homeopathic practice करें, allopathy या GP ना करें. This is our target कि maximum homeopathy करें. कई बार ऐसा होता है ना, लड़कियां BHMS कर लेती हैं, शादी कर लेती हैं, and then they just forget about it. तो ये नहीं होना चाहिए, ये नहीं होना चाहिए. You are a doctor, you should be able to practice, you should be allowed to practice, you should be keen on practicing अच्छे से, बिल्कुल सही तरीके से. एंड लॉट ऑफ पीपल थिंक कि इसमें आपको कुछ पैसा या नाम नहीं है, ऐसा नहीं है. इफ यू डू वेल यू अर्न लॉट ऑफ मनी. एक हॉस्पिटल जॉब या इवन गवर्नमेंट जॉब से कहीं ज्यादा इनकम होती है, इसमें कोई दो राय नहीं है. जस्ट नीड टू गिव फ्यू इयर्स. इनिशियली आपको कुछ साल देने पड़ते हैं. वो साल वो होते हैं जब आप छोटे होते हो, आपकी शादी होती है, न्यूली मैरिड होते हो, आपके बच्चे भी शायद छोटे होते हैं. वो स्ट्रगलफुल इयर्स होते हैं. मैंने अपने दोनों प्रेगनेंसीज में फुल 9 months आई हैव वर्कड. लास्ट डे तक मेरी दोनों डिलीवरी संडे को हुई, सैटरडे तक मैंने काम किया है. एंड आफ्टर 1 month अगेन आई वाज एट वर्क. सो आई हैड दैट थिंग इन मी कि नहीं, मुझे करना है, मुझे खाली नहीं बैठना है, मुझे अपना क्लिनिक क्लोज डाउन नहीं करना है. इवन ड्यूरिंग दैट फेज ऑफ 1 month वी हैड एन असिस्टेंट टू हेल्प कि नहीं क्लिनिक बंद नहीं, क्योंकि आप बंद कर देते हो तो वो बंद ही हो जाता है. फिर when you lose interest the patients go away. So don't close down. आपने चालू किया है, आप कंटिन्यू करो. आप शेयर्ड जगह पे काम करो, आप अपना सेटअप मत करो, आप पॉलीक्लिनिक में काम करो. ज्यादा बड़ा इन्वेस्टमेंट नहीं, होम्योपैथिक प्रैक्टिस के लिए नीड स्मॉल इन्वेस्टमेंट. आपको एक कमरा चाहिए, टेबल चेयर, एक अलमारी मेडिसिन का, एक या 2 अलमारी में आपका काम हो जाता है. डिस्पेंसिंग इनिशियली आप खुद कर लो, बहुत मिनिमल, मतलब इट्स वेरी इजी टू प्रैक्टिस. एक छोटा सा बोर्ड चाहिए आपको, बाकी वर्ड ऑफ माउथ आपका काम करता है. वेरी बेसिक. यू डोंट नीड एनी हाई फाई सेटअप, यू डोंट नीड सम हाई फाई, कोई इक्विपमेंट भी नहीं चाहिए आपको. हार्डली बेसिक बीपी apparatus and these things you need. Nothing is required. मतलब less than 50,000 में आपका सेटअप हो जाता है. I'm telling you this. I have 2 setups and I have started from a very small level. Polyclinic से मैंने भी start किया. But there should be the zeal to work कि मुझे करना है.
Yes.
बस zeal अगर है आप में तो आप कर लोगे. आप बहाने मत ढूंढिए कि नहीं मेरे इन-लॉज अलाउ नहीं कर रहे, नहीं मेरे पति का ऐसा है, नहीं मुझे 1 महीना मम्मी के घर रहना है, फिर 1 महीना मायके में रहना है. ऐसे नहीं करना है. यू आर अ डॉक्टर, भूल जाओ ये सब. फॉरगेट ऑल दिस. जिंदगी भर माँ बाप के पास रहे हैं, इन-लॉज तो आपके साथ ही हैं.
Yes.
1 महीना वेकेशन मनानी है, डिलीवरी के बाद नहीं आना है काम पे. अरे 2 आवर का क्लिनिक है आपका, आप बच्चे को फीड करा के ला सकते हो, आप बच्चे को लेके आ सकते हो क्लिनिक पे. नो बिग डील. वी हैव डन दैट. पीपल डू दैट. ऑल द अदर्स आर डूइंग दैट. तो
Yes.
जस्ट हैव दैट zeal. डोंट टेक द बैक फुट. नहीं बाद में नहीं. अभी है जो है अभी है. एंड इवन आई अर्ज माय यंगर जनरेशन कि आप इमीडिएटली आपका BHMS हुआ ना, विद इन फ्यू मंथ्स यू स्टार्ट. क्योंकि आपने गैप लिया तो गैप में यू लूज योर फोकस. देन यू टेंड टू डू फालतू के कोर्सेज कि इमरजेंसी मेडिसिन का कोर्स कर लें, ये कोर्स कर लें. दूसरे बलते कोर्सेज नहीं करने हैं. होम्योपैथी करना है.
Yes.
होम्योपैथी करना है. एंड छोटा सा सेटअप करो आप, पर आप करो, होता है. एंड देन यू मेक लॉट ऑफ मनी. ट्रस्ट मी ऑन दिस, यू मेक लॉट ऑफ मनी फ्रॉम इट. कोई पैसे की कोई कमी नहीं रहेगी. कोई कमी आपको कोई नहीं बोलेगा कि अरे क्या कमाते हैं. हाँ, नौकरी में नहीं पढ़ना है, बिकॉज व्हेन यू टेंड टू डू हॉस्पिटल जॉब्स ना, 10-15 हजार सैलरी के लिए आप हॉस्पिटल जॉब करते हो 8 घंटा, वेर यू हैव नो वैल्यू. यू हैव नो वैल्यू देयर. कोई इज्जत नहीं मिलती आपको. इवन इन जीपी यू डोंट गेट एनी वैल्यू. व्हेन यू डू होम्योपैथी आपको रिस्पेक्ट मिलता है सोसाइटी में.
I would request every participant, please on your camera so that I can have a pic for our memory. Just for a minute, can you please on your cameras?
Good, Varsha. Very good, huh?
Thank you, ma'am. Rest of the participant, please on your camera. Kamini ma'am, Manya, Dr. Rinku, Dr. Manya, Meeta Patel, Yogita Gajjar ma'am. Please on your cameras. You all are looking very beautiful. We just want to have one pic for our memory. Beena ma'am, Meeta madam,
Yogita, Rinku. Where are they?
Yes.
UK. Meeta Patel, I think from Kutch. Meeta, man, open karo camera. Rinku, Dr. Yogita, good to see you all. Very beautiful doctors.
So thank you. Thank you, whole HMAI team. It has been very short period of time I've been active in this group, and Dr. Mona ma'am and Krupali ma'am always support me and even keep a trust on me that I will manage the technical issues while having the webinars. And thank you, Dr. Anshita. I learned a lot and got a lot of confidence again on my practice. So that would help me out. And if you want to learn such type of thing, do join our webinars. We will come with a very interesting topic in the future as well. Thank you so much.
Friends, બધા જ આ રીતે પ્રોગ્રામનું આયોજન કરજો. મીતાબેન, કચ્છને થોડુંક એ કરાવવાની જરૂર છે. કચ્છનો અવાજ નથી આવતો.
Sure, ma'am. I will try my best.
હા, હવે થોડા વેબિનાર પ્લાન કરો. બધા તમે નહીં ને તો 2-3 નું ગ્રુપ બનાવો અને આ રીતે વેબિનાર પણ કરી શકાશે આપણાથી. કોઈ કેમ્પ કરાય, પછી ઇન્સ્ટા પર, યુટ્યુબ પર, ફેસબુક પર આપણે મૂકી શકીશું. ટોપિક તમે અમને આપો, અમે પણ તમને ફોલો કરશું એ રીતે હોય તો. કે ચલો આપણે ચિલ્ડ્રન રેમેડી છે તો આપણે બધા સાથે શેર કરીએ. ફિમેલ રેમેડી, ફિમેલ મેડિસિન એમ. ચલો પલ્સેટિલા છે, તમે ટોપિક આપો તો અમે પણ તમને પાર્ટિસિપેટ કરશું એમ. પણ અવાજ આવવો જોઈએ બધે, આખા ગુજરાતમાંથી બધાનો અવાજ આવવો જોઈએ એમ.
અને આપણું જે ગુજરાતનું WhatsApp ગ્રુપ છે, I think it's showing the biggest unity. આપણું all over ગુજરાતમાંથી 200-250 નું જે WhatsApp ગ્રુપ છે આપણું, try to be active in that group. કે એક એરિયામાં જે બી પોપ્યુલર પ્રેક્ટિશનર હોય છે એ લોકોના એક્સપિરિયન્સ ઓલ ઓવર ગુજરાતમાં પહોંચે. સો ઘરે બેઠા બેઠા we can enhance our knowledge. So that is the best way to learn. અને બધાને એન્કરેજ કરો.
ખાલી મંથલી એક જ એક્ટિવિટીની જરૂર છે. આખા મહિનામાં એક એક્ટિવિટી પણ કરશો ને તો તમને તમારા નામથી અમે સ્ટેટમાં ઓળખીશું એમ. આ ડોક્ટર વર્ષા આજે શોર્ટ ટાઈમની અંદર તમે વિચારો કે એમનું નામ આપણે જાણીતું થઈ ગયું. તો આઈ હોપ કે અહીંયા જેટલા લખેલા છે, યોગિતા છે, માન્યા છે, મયુરીબેન છે, આ જેટલા ચહેરાઓ દેખાઈ રહ્યા છે તે બધાના નામ અમે કહી શકીએ અને પ્રાઉડલી ફીલ કરી શકીએ એવું કંઈ કાર્ય કરો તો અમને આપણે સૌને આનંદ થશે. રાઈટ? ચલો, થેન્ક યુ સો મચ. આપણે ફરીથી મળીશું આપણા પાછા સારા એક વેબિનાર સાથે.
With this note, we will again meet again. And Dr. Anshita, we hope we will come back with you with a way more interesting topic on chronic cases as well in future. Thank you so much.
ડોક્ટર અંશિતા, આપ બી જરા HMI માં મેમ્બર બની જજો આપશે.
બિલકુલ બિલકુલ.
ઓકે,
Thanks a lot. Bye bye.
બાય. સી યુ.